Waktu. Good morning to you all. His Excellency, Director of Universitas Airlangga, respectable the Chairperson of the Journal Development and Scientific Publication Center at Universitas Airlangga, and the Honorable Academia, researchers, students, and all other participants of this webinar. Ladies and gentlemen, my name is Gesnita Nugraheni. I am a lecturer in Faculty of Pharmacy, Universitas Airlangga, and I will be the moderator of today's webinar. I'm very pleased to meet you here and welcome all of you to this webinar. This webinar is conducted by the Journal Development and Scientific Publication Center at Universitas Airlangga. Universitas Airlangga commits to support its staff and students to fulfill their research potential and internationally publish their scientific findings in Scopus or ICA Index journals. And Universitas Airlangga is currently undertaking continuous quality improvement programs, particularly in research and publications. And the programs aim to build Universitas Airlangga as a world-class university, being able to occupy the top 500 world university ranking. Ladies and gentlemen, our today webinar will discuss about the systematic review and meta-analysis in pharmacy, how to write and get published in high-impact journal as postgraduate students and academia or research fellow. And this webinar is aimed to give its staff and students a place to learn from top international researchers and to provide strategies of publication and citation in high-impact journals, and to motivate academia, researchers, staff, and students to engage in research actively and publish a high-quality article and in turn increase the citation score. Okay, first of all, may I briefly introduce to you our first speaker. The first speaker today is Dr. Elida Zairina. She is a lecturer at the Department of Pharmacy Practice, Faculty of Pharmacy, Universitas Airlangga. She received her Bachelor of Science in Pharmacy and Apothecary from Universitas Airlangga and received her Master of Public Health from Universitas Maastricht, the Netherlands. And then she completed her doctoral degree in Monash University, Melbourne, Australia in 2015. And then in 2017, she received an Endeavour Research Fellowship to do a project related to asthma management in Monash University, Australia. Dr. Zairina has a background in conducting a clinical trial to investigate the role of telehealth for optimizing asthma management during pregnancy and the role of pharmacists in asthma management. And now her particular research interest is chronic disease management during pregnancy and particularly those with asthma. She currently running project about risk assessment in non-communicable disease and barriers and medication adherence. Besides research, Dr. Zairina has various experiences in management and organizations. She has been appointed as a chief editor of Jurnal, Farmasi, and Ilmu Kefarmasian Indonesia, or JVK, from Universitas Airlangga. And then currently, she's also a coordinator of examination material in the Student Admission Center at Universitas Airlangga. Okay, ladies and gentlemen, before the presentations begin, let's know the regulation, how the presentation will be going on. Firstly, I'd like to give the time to Dr. Zairina to present the material for about 60 minutes. And Dr. Zairina will be presenting about writing a systematic review in pharmacy according to preferred reporting items for systematic reviews and meta-analysis, or known as PRISMA. While listening to the speaker, you may ask questions by typing them through the Q&A box with the format your name and underscore speaker one, and then your question. Now, allow me to welcome the speaker, Dr. Elida Zairina, to deliver her presentation. Dr. Zairina, how are you today?
I'm good, thank you, Bu Gesnita. Thank you so much. So should I start?
Yep, if okay, so the time is yours.
Okay, thank you so much for very nice introduction, Bu Gesnita. Hello, good morning all, and good afternoon to Dr. Edwin Tan. I believe it's already afternoon in Sydney now. So I would like to start my screen first before, okay. Okay, so before I start, again, I would like to thank you for the Journal Development and Scientific Publication of Universitas Airlangga for having me in today's webinar, and that we are going to discuss about systematic review in health science and particularly in pharmacy. So today's outline of my presentations are showing here. And to begin with, I would like to show you this picture, because I know that probably most of you has already seen this picture so many times. So this picture shows about the hierarchy of research designs and the levels of scientific evidence. So we can see here like the level of evidence, or sometimes called the hierarchy of evidence, are assigned to studies based on their methodological quality of their designs, their validity, and their ability to control bias, and also their applicability to demonstrate cause and effects in human. And this means like their applicability for patient care. When we are searching the informations, like the evidence-based informations, we should start from the top of this pyramid. It means like we are looking the highest level of evidence, starting with the meta-analysis or systematic review. Why? Because this kind of evidence has been reviewed, has been gone out through the evaluations process, has been critically appraised. So this kind of evidence is called filtered information. And then as you move up here, we can see that not many students at the top of the pyramid are available. If this is the case, means that you need to move down to find which kind of study to answer your clinical questions or to answer your research questions. And then before we are talking about systematic review, I would like to review it again. What's the difference between literature review? It means the traditional review and the systematic review. So we can identify first, you can think about how to distinguish or how to differentiate between systematic review from a narrative review. And are there any advantages or disadvantages if we are conducting a systematic review? So from here, we can check if there are any difference between systematic review and the traditional review. So the systematic review, they are using a set of the search strategy, while the traditional review, they don't need to do a search strategy. The systematic review also have the database that has been predefined previously before the author searching the articles. So that's why it's called searching the article in a systematic manner. While the traditional review, we don't need to using several databases. And because it has the systematic manner for searching the articles using a specific databases, it can be replicated by another independent researcher, while the traditional review sometimes cannot be replicated. The systematic review have gone through the evaluation process to minimizing bias of each study. So that's why it's minimizing bias, while the traditional review, because it hasn't done the critical appraise process, it may contain bias. Often involves a team of researchers. So it's not possible, it's very rare to do a systematic review by only one author, while the traditional review or the literature review may involve one researcher or one author. The conclusion of the systematic review can be based on the series of the set of the predefined outcome measure from each study that has been decided previously before the author conducting the searching strategy. While the traditional review, the conclusions may base only on findings of the studies that including in the review. And then we are talking about the advantages of systematic review, because like I know probably most of the participants are the postgraduate students. There are some advantages when we are doing a systematic review. We can use clear and true methods to identify and critically appraise the relevant study to answer the research question that we have defined before. And then the postgraduate students can learn both the systematic evidence-based review process and also learning about the primary research methods. They also will be mastered and encouraged to improve their skills in critical analysis. And the students also can learn new methods to do independent research, and it's also a good opportunity for students to engage in broader range of research methodology, because they need to know about the quality of its methodology from the relevant studies that they are including in the systematic review. And particularly for PhD students, systematic review can be as a good foundation for their dissertation topic to establish before they are doing the primary studies. And the good thing is, if you're doing the systematic review, you don't need an ethical approval from the research committee, because you are using the secondary data. And of course, there are also some disadvantages if we are doing a systematic review. That usually the time constraints, because a good systematic review search strategy may require at least 6 to 8 months to complete. And this is also depending on the relevant literature that you are looking at or that you are including in your systematic review. And the capacity constraints in terms of the skill of the faculty or the staff supervisors may also need it to do the good systematic review methods. And the others main problem, I think this is like have been facing or have been experienced by students, particularly in the university in Indonesia, that have the minimum access to electronic databases. And also depending on the research questions, the large or little amount of the literature can constrict the literature review process. It means that the more you have the article that you are including in your review, it means like the more time you need to do the review. The assessing tools and the tested algorithm may not available for certain qualitative research method if you are including a qualitative research paper in your review. And some people say that systematic review often difficult to publish in peer-reviewed journal, but it's not always the case, because especially during this pandemic, I think most of journal is also open more opportunities for authors to publish a systematic review, because the hardship for conducting the primary research in the field. So now we are moving in the systematic review. So what is systematic review? It's usually became the gold standard in reviewing process. If you are learning about the literature review, there are scoping review, there are narrative review, and the systematic review is currently become as a gold standard in a reviewing process. The aim is to answer to do the scientific approach to answer a specific research questions, and also to minimizing bias. And because systematic review have gone all the evaluation process, that a critically appraises process, that's why a predefined protocol is important before we are starting the systematic review. And why systematic review? Because this is one of the efficient way to access the body of research. It saves time required for searching, instead of looking for 100 of articles, if you found the systematic review that relevant to answer your question, this is more saving times compared to looking for hundreds of articles. And then it has been critically appraised. And then the author is usually interpret the result based on the study they are including in the review. And it also can explore the differences between studies that including in the systematic review, and also the reliable basis for decision making, because the author has minimized the bias. So unbiased selections of relevant information is already stated in the systematic review, and it's useful for those who are working in the healthcare area. The policymaker is also if you want to do the future research. And there are some key criteria if you want to do the systematic review. The first thing you need to have is a clearly formulated clinical questions, and then predefined inclusion and exclusion criteria according to which study that we are going to include it in the review. And we need to have a comprehensive search in the medical evidence sources or the databases that we are decided to use when we are searching the article. Critical evaluations of included clinical trials, and quantitative data synthesis, and also the reasoning based on the scientific evidence. We will talk in details later on. So before you start, just bear in mind that we need at least like 4 tips for doing the systematic review. First, just to make sure that there are no other systematic review that identical to yours that has recently been conducted. But it doesn't mean that once it's get published that it's recently been conducted, it means like less than a year or less than 6 months. But it doesn't say that you cannot do the systematic review if other author has been done the same title like yours. Just see if there are no more students, no more articles arise or published. That means that there's no use to do a systematic review. But if there are, after the review has been published and you found that there are already like a lot of articles published that were not included by this author, then it means that you can do the systematic review that's similar with that author, but just saying that you are updating with adding new articles. And also need to make sure that there is a need for a review, that the topic is really important and is interest for the editor for the journals. And it's very important is also to writing a protocol or a plan. The protocol doesn't need to be published or registered, but at least you need to have a protocol or a plan before you start the systematic review. And it's also important to have a critical from colleagues, panel, or your supervisor. So these are the steps that we want to do the systematic review. Plus, the first one is you need to define the review question first. You have the review question, or you have the research question, or the clinical research question that you need to answer by doing a systematic review. And then you develop the search strategy. After you develop the search strategy, and then you searching the evidence through the database that has been set before, and then select the relevant study from the search, collect data from the relevant studies, and then assess the risk of bias in each relevant studies that you are including in the systematic review, synthesize the results, either qualitative or quantitative. If you want to do quantitative, means that you need to do the meta-analysis, interpreting the results, and then present the result. And this is the one that I put it in red here. This is like the most important part for if you want to do the systematic review, if you are including the type of the studies. But this is the Cochrane Handbook for Systematic Review of Intervention has been produced a guideline for authors if they want to do the systematic review or meta-analysis, and how to do the risk of bias for its included study. They already explained it in that guideline. So let's start with the first step, formulating the research question. Consider variation that you may wish to explore in your review. if you are only including the studies that you want to assess the effectiveness of such intervention, you may define your research question based on the PCOP acronym. So the P stands for types of participants or populations, I stand for types of the intervention, C is types of the comparative group, and O is type of the outcome measure, and T, this is the, it could be timeline or time of the study. But when most of you are not going to assess or see the effectiveness of intervention, you may go to the formal clinical questions or the research question based on the PH. So P is type of participants or population, while E is types of the exposure or issue. I think this is mostly conducted in the public health research. And the O is types of outcome measure, while T is type of the study design. But before you finalizing your question, just make sure that you have checked at least there are enough primary research study or paper to cover the topic. Means like, you know that, okay, there are some paper that with the type of randomized control trial that is quite enough to do the systematic review, and then you may start your review. And then the other question is, do you need a broad or narrow questions? Of course, there are some advantages and disadvantages for the narrow or broad questions. The advantages is easy to write if you have a narrow question and easy to read, but disadvantages are it needs multiple reviews, may need multiple reviews. Why? Because you find that your question is too narrow, and then you find like the result is not going to cover the research question that you have been designed before. And it's also maybe selectively defined because it's too narrow, and then you may just like pick up some articles that you think is gonna answer your research question. But if you want to design a broad questions, the advantages are it will be more comprehensive, and it can be more generalized to the population that can be more big populations. And then, but of course the disadvantages can be complex. It may miss subgroup effects, and the overview of reviews may be preferable because you have so many like too broad question, and then you found that there are so many subgroup analysis, like the population have a different condition that need to be reviewed differently. So moving up to the inclusion and exclusion criteria, there are some rules to decide which study are included in the review. It could be based on the sum or all your PICO components, plus your definition about eligible study design. The population, it needs to be clear definition to identify people of interest. There are two aspects that need to be considered. The health condition. For example, if you are including population with asthma and has been diagnosed asthma by whom? By their physicians, by their doctors. And then the population setting, if you are including like, you're gonna population those with asthma who have been an inpatient only or outpatients also included. And any limits, if you put some limit, is have to have a clear rationale. The alternative is not to include and explore in subgroup analysis. If you think like the population have so many conditions that may need to be in subgroup, then you may need to do the analysis, the subgroup analysis. And also the need to consider the equity and spatial populations based on gender, age, ethnicity, geographic, economic educations, the diagnosis or severity of disease. And you need to describe your population or your patient group. Why? Because different prevalence, progress, and impact of disease may also affect the result of the intervention. The different effects or safety of the intervention as well, and also the different outcomes of importance. So that's why like when you need to define the population, just to make sure that any prevalence or any progress will not give an impact of the intervention that you are going to assess. So what type of intervention that you are going to assess? define the intervention you will be using. Give as much as detail as possible. If you are looking the effect of some drugs or medicine, then give the detail as possible. Formulations, the dose, the time given, the delivery, and any intervention that probably is not only about the drugs or the medication, but make sure that how the intervention can be accessed, the equipment, is there any socio-economic or rural and urban setting, and any limits that you have defined should have a clear rationale. The alternatives can include and explore in a subgroup analysis. So if you are going to assess the effectiveness of the intervention, of course, they need a comparison to compare with the intervention that you are going to assess. Based on the objective of your review, define the specific active comparison in much detail as the intervention. Be clear if you are meaning by no intervention. No intervention could be like standard care or usual care, or the participants in the control will be given as a placebo or etc. Can also remain open to any comparison found, but need to be explicit. For example, if you are not sure about the comparison for this, for this intervention because you haven't seen in some studies, you may remain as open, but again, be explicit, at least give a details about what no intervention you are meaning in this review. The outcomes, because we are going to assess such intervention, the outcomes measure need to be identified as well. Define the outcomes for whom, for the consumer, for the health professionals, or for the policymakers. If you are going to assess the outcome based on the adverse effects or the relevant different populations and the key time points, then the measurement option and validation, this outcome needs to be identified in your research question. Consider outcomes that used by reviews or related topics, and then the important outcomes should be included in the protocol and the review, whether or not data are likely to be found. So if, for example, if you found the research question first, and then you found that for most the studies included in my review, the main outcome or the primary outcome have not been found, but doesn't matter because you already stated in your research question, just saying that there are no study measuring the outcome, while this outcome is very important to assess the effect of the intervention. Prioritizing outcomes, that usually the systematic review or meta-analysis, they have a primary outcomes from the study that they are going to assess. May take at least maximum 3. 1 is okay, but the maximum is 3. And then you can put it the rest as the secondary outcomes. Could be the remaining main outcomes or additional outcomes. Could be surrogate outcomes, process outcomes, explaining in the effects. The main outcome in total is maximum 7, is because it's essential for decision making from the basis of analysis and summary. Don't have too many outcomes because it's gonna be it's a bit difficult. It's a bit hard to synthesize all the data result if you have so many outcomes, more than 7. Study design, select the most appropriate design for your questions. Well, for most Cochrane review, they are including RCTs, randomized control trials, and prevent systematic differences between groups. And they sometimes also including control clinical trial or the quasi-randomized design. And the other question is it possible to including non-randomized studies? It's rare, but possible. At least you need to have a clear rationale. Because, for example, RCT are not appropriate or unlikely to be practical. There are no studies that has been designed as RCT because it related to public health or complex health system topics, and also to measure particular outcomes, adverse effect, economics, qualitative outcome is not possible to do or design study to based on the randomized control trial if you want to see the adverse effects of some drugs. And the reason is not just because the RCT are not available, just so give a rational, clear reasons why you are not including a randomized control trial study. Specific designs preferred. Other designs such as patient series, cohort, or maybe only qualitative study is possible to do the systematic review, but of course, it probably is not possible to do meta-analysis. Be aware of increased risk of bias, because from the hierarchy of evidence, the studies that are not designed with minimizing bias may have some bias that been conducting during the study. And then after you've designed your research question, now it's time for developing the questions. How you frame the question will depend on the focus of the problem. For example, if you have a diagnostic and prognosis research question, then cohort studies may be a well-designed study for your review. If you are going to assess the intervention, the efficiency, or the cost effectiveness, the RCT studies maybe need to include it in your review. And if you are going to assess the client perspective or patient's perspective, a qualitative study design may be appropriate to answer the research question. The type of question that you are going to develop will influence the type of the evidence that you will find in the literature. The search strategy, after you find the research question and now the search strategy, lists all databases that you are going to use. Report the dates on when you search each database, any language or publication status restriction that you are going to do for your review, any other data sources, any researcher or organization who were contacted as part of the research, or hand searching of reference lists in papers, journals, or conference proceeding. So when you are doing or setting the search strategy, you need to write down the specific keywords from research question. Need to say which databases with dates that you will search. Need to check all the references of all the papers that you are including or that you are find to make sure that you have not missed any relevant work. You may search also the gray literature. It could be the conference presentation, the doctoral thesis, the unpublished work, and also doing the hand searching means that you are contacting the author from the reference list of the paper that you are included in your review. And also the personal communications author of paper. If you are knowing, if you know some of the authors, but the authors hasn't published the paper, you may contact them personally. There are some really good sources for finding studies that are called Center for Review and Dissemination. You can find any review or any articles that has been done by the author that published in this source. And type of source, one need to use scientific databases, scientific journals, organizations, website, library, expert. For the systematic review, there are some databases that are encouraged for author to use it at least. There are Medline and then Embase, PsycInfo, and then there are also like some Google Scholar, but there are also some gray literature. And then the question is how many databases that we are going to use or which databases that we need to start first. You can start from here, the bibliologic databases, started from Cochrane, Medline, Embase, and then work down here until the other sources or journal and other databases, unpublished and ongoing studies. For the systematic review, the Cochrane review and has suggested that at least there are 3 most important electronic medical database that you need to include in your review. Could be Medline, Embase, and Central. Because these bases, in the fact they have all specific journal index in these databases, then all articles published in it are listed in this base. But sometimes maybe there are some journals or some articles that is not indexed in both in Medline or Embase. Then you may fill the gap by going to central databases maintained by the Cochrane collaboration. Then you can find that there are articles, there are not, or journals that are not indexed in Medline or Embase. You can find it in here in Cochrane, the central database. And also sometimes for the publication or journal that is published in their original language other than English, they are made available in the other website or Cochrane collaboration that you need to check. Managing your result. Store result from each source. Download all available fields for each record. So it's not possible. Is it possible to do the systematic review without any help for the reference manager? It may be possible, but you're gonna be really difficult to do it. So many guidelines have suggested at least use one of these reference management software. You can use EndNote, Mendeley, ProSite, Reference Manager, or Reference Work, or Zotero. I'm sure that some of you are familiar with this kind of reference management. And also ask for help with configuration files and how to import filters, how to make some notes, and then why you need this kind of reference management, because while using this software, it can help you to collate or duplicate your including study before you doing your review. And then after you find the reference manager, documenting the search. Documenting the search can be to report transparently when you have done your review, to reproduce or update in the future. And also, just give me a second, I'm sorry, I think it's gonna be delayed. And also, this is to make sure that if you have more than one of the author, like you and your other authors, they can see together about the search that you have been done. So what need to be documented is what database and interface that you are using, and when you are doing the search, the date limit, and how you copy and paste, exact the strategy, limit the set number, and keep copies of everything. You can save locally or on paper, but please don't rely on the internet bookmarks or save search. It's not gonna be helpful. Just it's better to have a locally or in a paper, and also save exported text file. So this is the example. If you want to looking for the paper based on the Boolean operators, can be using and or you can use a truncation or wildcard word. So it depends on your research question. If you are put it a Boolean operator like and, it means like the search engine will include any articles who have populations and adults. But if you put it or, they will include it all, either have only population or adult. So this kind of table that you need, sometimes you need to include it in your paper as an appendix at the end of the paper. And this is also the strategy list that you may need to do. You can combine for example, patient, client, and invalid, and then you can combine patient or client or invalid, and etc. And this also may, the strategy list, sometimes the journal is also ask you to put it as an appendix on your paper. It can be published, or it can be just put it as editorial needed to review your article. I will explain like about two databases that usually included or used by the authors to do the systematic review. The first is PubMed. PubMed is a free version of Medline. How to do searching article using a PubMed? You can ask the librarian, and in PubMed there are some printable instruction and tutorial, and also how to search using the medical subject heading. So the list of the word for searching the article from PubMed, they publish the list of the medical subject heading. You can find from the PubMed website. They give clear explanations about how to search the article with some specific keywords, and it's helpful a lot for the authors who wants to do the systematic review. And PubMed is, most of the PubMed article, they are using American English spelling for the PubMed system and the terminology. And it has automatic term mapping. So truncation and wildcard, if you are using for your search strategy for your keywords, should be used within caution, because they will only detect some of phrase, again, because they are using automatic term mapping, so they have the list of the medical subject heading as a word. And for Embase, you can ask the librarian, and you can also using quick reference guide from Embase. They have produced the how to searching articles from Embase database, and they also have Embase help online. And then if you want to ask question from Embase, they just put in the question and they will give response straight away. So this is like the PubMed database if you are already looking for your keywords. For example, for the search, for the first search, you are searching based on the word populations and the diabetes mellitus, and your result will about more than 250,000 articles. And then after you modified your search strategy, you will end up with 65 articles, which is reasonable to screen before you're doing the review. And how to select once you found the article, how to identify when you are doing the systematic review. The first things to do, initial selection based on the title and abstract is performed. So after you put it all of your article in your reference manager, the first thing you need to do is you search the titles and the abstract based on your research questions. And then the remaining papers will go the verification based on their full text. It is required at least done by 2 investigators or 2 authors working independently in order to decrease the risk of an error. So once you have done the process, there are some guidelines, the PRISMA guideline, that is makes possible to repeat the process. So this is like the basic process when you are doing the systematic review. And also this is the Cochrane handbook. After you including the articles, you need to assess the risk of bias for each study. So the Cochrane have produced the guideline to explain about how to do the risk of bias for each study. And then so there are some software, if there's question, is there any software to help us when we are doing the systematic review? There are some software that have been developed by some of the company that it may help you to do the systematic review. Help means that at least organize your articles, organize your included study before you're doing the review. So this is kind of like after you put all of the article in your reference manager, this software help you at least to screen or to read the full text of the included study, and help you also to duplicate the studies. And then the good thing is about this software, you can also work or invite other authors to do the review. So for example, if you find like 65 articles need to be reviewed by 2 authors or 2 investigators, and then you can ask, like, for example, your supervisor to also to join the software that you are going to use. So each of you can review the paper independently using the software, and then you can meet up, then you can discuss about, so this is article that we need to include it in the review. So you can try after this webinar, like what kind of software. The software that I'm currently using with my student is the Ryan. It's a free software, and I found that it's quite user-friendly to do. But maybe for us that have been using it for the first time, it's a bit difficult, but they have a help guideline that is easy to read and to do. But it doesn't have that if we cannot do use this software, it means that we cannot do systematic review. No, it's not. You can do just doing by EndNote or Mendeley if you are not familiar with this software. So, and then after we're doing the systematic review, it's now like, I'm gonna give a brief explanations about how to reporting the systematic review. Reporting and doing systematic review is two different things, because doing systematic review is the previous slides that we have discussed, but then after we're doing the systematic review, now it's time to present the result, or it's time to report our review or our meta-analysis. So there are some guidelines that you can check. That's the PRISMA, preferred reporting items for systematic review and meta-analysis. So this is the guideline when we are going to write our review. To minimizing reporting bias, the PRISMA have given a guideline for authors once they are finished their systematic review, and now it's time for them to present the result. There are also, if you want to check the quality and transparency of studies, you can check the consort/stroke PRISMA guideline in this website, the Equator. And also, if you are working together with the Cochrane, you can also have a standard for reporting for the Cochrane review. So I'm gonna just give a brief explanation. I'm not gonna cover all of the part of the PRISMA that you can check in the PRISMA statement website. So what is PRISMA? PRISMA is an evidence-based minimum set of items for reporting in systematic reviews and meta-analysis. It's focusing on reporting of reviews, evaluating randomized trial, but also can be used as a basis for reporting systematic review or other types of research. And who should use PRISMA? It can be used both by authors, because it helps authors to improve the reporting of systematic review and meta-analysis before they are submitting to journals. And for the journal peer reviewers or editors, PRISMA also help and useful for them for critically appraisal for the journal for the article submitted to their journal. If they want to publish this systematic review, they need to assess whether this author has complied with the PRISMA guideline. So you need both by the author and the journal editor. And since 2009, the PRISMA statement has developed some PRISMA extension. So you can check. It's not only for the systematic review and meta-analysis, they also have a design or a guideline for the protocols or for scoping reviews, not only systematic review. So I suggest that if you want to write a report or a publication and you want the journal to publish your systematic review or your scoping review, you just use this PRISMA guideline to write your report or your manuscript. And the PRISMA extension for scoping review was published in 2018. There are at least 20 essential reporting. It can be also not only for scoping review, systematic review, and other objectives. You can check in their website, the PRISMA statement org, and then you found that the guideline for its review. And this is the guideline for the PRISMA if we want to do the systematic review, whether it's with or without meta-analysis. Probably it's too small here, but we've gone on, it's only from some part of this guideline that I think this is like the most important part. So for the title and abstract, the title, if you want to write the publication about systematic review, just write the report as a systematic review. Or if you are including meta-analysis, just write systematic review and meta-analysis. The tips is include the term systematic review in the title. So the authors, so the journal, or when the authors search your article in the search engine, is also it will be indexed for the first time. And then ensure that the title reflects the key component that inform the eligibility criteria of the review. For example, populations, concept, and context. While when you are writing the abstract, you need to provide the concise descriptions of the aims, methods, findings, and conclusion of the scoping review if you are doing the scoping review, or the systematic review if you are doing the systematic review. if you got any fundings, you can also put it in the conclusion or in the abstract. I think the abstract and the title is similar when you are writing a manuscript for other primary research, not only for the systematic review. The methods, I will go to the method that makes a difference why systematic review compared to other primary research. Indicate whether a review protocol exists and whether it can be accessed. Again, you can publish your protocol through the Prospero, but if you are not going to publish your protocol, it doesn't matter, you still can do the systematic review. The protocol is for you and for your co-authors to guide when you are doing the systematic review. The tips must be developed prior and include information on how protocol was developed if you want to publish. If you get your protocol published, you can put it in your methods in your systematic review manuscript. Just say that the protocol has been published using, and then when it's been published, etc. The eligibility criteria is different compared to primary studies because you will explain about the specific study characteristic like PICOs, the length of the follow-up, years considered language, and also clearly describe the eligible treatments that you are going to assess, specific characteristic of the source of evidence, for example, the years, the publication status, etc. Other methods that you need to inform in your manuscript is the information sources. Which database are you going to use? Were you using? Like, for example, this article, the database was searched from 2004 to June 2015 using Medline, etc. And then these information need to be described clearly in your methods. Other methods need to also, including the search and the study selections, how you search, what kind of keywords that you are using, how you screen the articles, how the study were selected, and who will select the articles, how many authors involved. And then once after you put the search strategy, you need to describe how the data extracted. Are you using some specific forms? Are you using some specific software, and list of define all the variables with that collected? For example, you are including geriatric patients with diabetic mellitus who were undergone surgery for 1 year or after 1 year surgery, and etc. And then the most important part for the systematic review is assessing the risk of bias across the study. This is specific for the randomized controlled trial study. You need to specify any assessment of risk bias that have been done. You can put it as based on the guideline for the Cochrane risk of bias scale, or you are using a different tools to assess the risk of bias. All of the assessment regarding the risk of bias need to present and the methodology. And the result. This flow of chart of the study, it needs to be included in your paper, in your systematic review. So this kind of paper, for example, after going through all of the searching multiple databases, you end up with more than 1,000 articles. And then after you are searching from the hand searching or other records, you found 44 articles. And then after you remove all the duplicates articles and screening, and then full text article to be assessed for eligibility. And then after excluded, you will end up with about 40 articles that needs to be included in the review. So this kind of process need to be put in your manuscript or your website, because this is the process that the authors or other readers will read it about how you gun the process. That's why I say like the systematic review can be replicable by other authors, because the authors always sets a keywords, a set of strategy that can be replicable by other authors. And then the result for the study characteristic. For each study, you can present the characteristic for the study included in your review as like a study size, the PICOS question, and the follow-up period, and provide the citations. For all outcomes considered, the benefits or harm, you can put it as the simple summary of its intervention, or you just put it the confidence interval or the significant level for that. This is, for example, if you want to put it the result for the included study. You can put it like the author, the aim, and then the setting of the study, the populations, the study design, and the intervention. This is like based on your PICO question. It depends on how many studies that you are included in your review, then you can put it as a table. And if you are going to do the meta-analysis, I think Dr. Ed will gonna explain the detail later on. Sometimes that you need to put it as the risk of bias for each study, for each RCT studies. And you can also put it as based on the Cochrane systematic review that like, for example, the green indicate the low risk of bias, the green thing, and the red high risk of bias, and then something that you need to demonstrate in your paper. And then if once you assess the risk of bias for each study, and then it's time for you to synthesize all the results, you can summarize or present the charting results as they relate to the review question as an objective. You can present data as a map framework or describe narratively if you found that each study will have a different outcome or different intervention, but the same population. You can put it just like the table here, put it as the appendix, or if you're going to do the meta-analysis, sometimes they have like some like forest plot like this picture, and then when we can read like the odds ratio for each study or each intervention. And for the discussion part, the discussion will be the same like other manuscript. Usually you can summarize of the evidence, provide a summary of the main findings, and then the limitations for your review. For example, if you will not assess the outcome of these interventions because there are not many studies using the outcome, and etc. And also comments on the validity of the assumption, and probably for the future next research. And for the conclusion and funding, you can just provide the general interpretation of the result, describe sources of funding if you have for the systematic review and other support, for example, supply of data. And this also may include information regarding whether funding has been received from some particular manufacturer of treatment, and etc. So last, what take-home message that we need to think about it. The steps in conducting review are define your question and ideally register your proposed review title with compare or concurrent or similar if you wish to register your title or your protocol. Specify and publish your proposed methodology in advance in the form of a protocol if you wish to publish. Conduct a thorough search of the literature once your protocol have been completed, and then you now doing the search strategy. Screen your search result against your pre-specified selection criteria to identify included study, and appraise the quality of studies found. Synthesize the evidence. This is where the conclusion whether meta-analysis is needed or not, and then publish and disseminate your review. Update the review if you found the new evidence is coming, and use Prisma guideline to write the report. Yeah, I think that's all from me. Thank you for your attention. These are the references that I've been using for the presentations today, and I believe that we will have the question and answer at the end of the session. Thank you, Bu Geta. I'll hand it to you.
Thank you very much, Dr. Elida Zairina, for giving such informative and interesting presentation about how to write a good systematic review based on Prisma. Surely all participants will have some insight of writing a systematic review, and we hope that they will be willing to soon writing right after joining this webinar. Okay, ladies and gentlemen, we still have one distinguished speaker with another interesting topic. Our second speaker today is Dr. Edwin Tan. He is a National Health and Medical Research Council and Australian Research Council Dementia Research Development Fellow and Lecturer in the University of Sydney, Faculty of Medicine and Health, School of Pharmacy and Aging Research Center, Karolinska Institute. He's also a registered pharmacist with clinical experience in both Australia and the UK. Dr. Tan graduated with a Bachelor of Pharmacy with honors in 2007, and he was awarded his Ph.D. at Monash University in 2014. Well, it's kind of a reunion with Dr. Elida Zairina. And his doctoral thesis, a team approach to optimizing medication outcomes in primary care. And it was awarded the 2014 Molly Holman Doctoral Medal. And in 2015, Dr. Tan received an Australian Government Endeavour Research Fellowship and the Honorable Geoffrey Conrad AM Travel Award to undertake postdoctoral training at the Department of Population Medicine at Harvard Medical School and the Aging Research Center, Karolinska Institute. Dr. Tan's research interests are in pharmacoepidemiology, pharmacy practice, quality use of medicine, and cognitive health and aging. And his current fellowship investigates the management of comorbidities in people with dementia. And Dr. Tan has published over 60 publications and have been awarded over $900,000 in competitive research funding, including from NHMRC, ARC, Alzheimer's Australia, Australian government, Alzheimer Foundation, and Karolinska Institute. So for today's webinar, Dr. Tan will be presenting exciting topic about meta-analysis in pharmacy and how to get published in high-impact journal as postgraduate students and academia or research fellow. I'd like to give the time to Dr. Tan to present the material for about 75 minutes. And again, you may ask questions while listening to the speaker and then typing the question to the Q&A box with format. Please mention your name, affiliation, and then speaker 1 or 2, and then the question. Now allow me to welcome the speaker, Dr. Edwin Tan. How are you?
I'm very well, thank you, Gesnita. Thanks very much for having me today.
Okay, if you're ready, the time is yours.
Thank you. I'll go ahead and share my screen. Okay. So hopefully you can all see that. So yeah, as Gesnita mentioned, Elida, my colleague, was very kind to invite me to speak to you guys today. So it really is a privilege to speak to you. So thank you very much for attending. Today I'll be focusing more on the meta-analysis side of things. So Elida gave a really great introduction about conducting systematic reviews. So I'll be carrying on that and talking about meta-analysis. But I also spent about half my session talking about how to publish in those sort of high impact journals. So yeah, let's get straight into it. So firstly, I'm just going to give a kind of a brief overview of meta-analysis. So I won't go into too much detail, but I'll kind of just introduce sort of what a meta-analysis is, why we might do it, how do we go about doing it, when should we do it, and who should be conducting these meta-analyses. But before I go into that, I thought I'll just go a little bit more into my background. I know Gesnita gave me a very long introduction about sort of my history, but I'm like you. I studied pharmacy. I went to Monash Uni. I did my undergrad in pharmacy, graduated as a pharmacist, worked in both community pharmacy and hospital pharmacy, went to the UK, worked as a pharmacy technician in hospitals over there. So I come from a sort of a clinical background. And then I did my PhD in Monash with Elida. My project was very much health services research, looking at pharmacists working in GP practices. As part of that, I did some qualitative research, so some interviews and focus groups. We also did a trial, so I got to do some quantitative analysis. But one of the key sort of components of my PhD was conducting a systematic review and meta-analysis. It was one of those things where it was the first thing I started and probably the last thing I finished with my PhD. So I understand it is quite a challenge to undertake, but since then, I've managed to keep doing systematic reviews and meta-analyses. So I've definitely published a few more since then, and I've built up a bit of more experience in doing it. So hopefully I can share today some of that sort of wisdom I've collected. I wouldn't say I'm an expert, but I've definitely had some experience in conducting these. Just to show us where we are globally, so I'm currently at the University of Sydney. So that's on the southeast coast of Australia. It's just above Melbourne, which is a little bit more south. So I grew up in Melbourne, so I'm from Monash Uni. I went to Sweden for 2 years to do my postdoc. So after my PhD, I kind of went more into pharmacoepidemiological research, so looking at the way medicines are used in larger populations. Kind of moved more into geriatric research, in particular dementia. So I was at the Aging Research Centre for 2 years, then came back to Sydney to take up a lectureship here. And here is your lovely university. I've not been to Indonesia yet, but hopefully I get to visit one day. So yeah, I do love research. I think it's a very global enterprise. So it's really nice to see how we can all sort of work together and collaborate. So let's get straight into the point of today's session, which is to talk about meta-analysis. So what exactly is a meta-analysis? Well, essentially, a meta-analysis is the statistical combination of results from 2 or more separate studies. So here, for example, I have study number 1, 2, 3, 4. I have each of those individual studies and their results. What a meta-analysis does, it helps to combine those results together in a statistical way. And what it does is it yields an overall statistic that helps to summarize the effectiveness of an experimental intervention compared with a comparative intervention. In most cases, we are looking at interventions, but we can also look at a particular exposure. We can look at the prevalence of something as well. But in most cases, we do look at some sort of intervention and its effect. So where does a meta-analysis occur? So Elida alluded to this Prisma diagram. And with systematic reviews, they kind of end in this sort of red box here with the qualitative synthesis here. With a meta-analysis, we then take it a step further and we then quantitatively combine our results of the studies. So we do this quantitative synthesis. As you can see here, the numbers tend to be a bit lower. So we start off with 52 studies included in our final systematic review. Our meta-analysis is a subset of those studies which can be combined in an appropriate way and can be analysed. So that's why it's a slightly smaller number. So that's where it occurs. It's like the next step after systematic review. So I thought I would start off with just illustrating some examples from Farmasi. So these are a couple of papers that I've worked on. So that sort of notorious first systematic review that I talked about as part of my PhD, that's this one. So we're assessing the effect of an intervention. So we're looking at whether pharmacists working GP practices made a difference on a range of outcomes like blood pressure and cholesterol and things like that. One of the more probably later systematic reviews I did maybe a couple of years ago was this one about medications that cause dry mouth as an adverse effect in older people. So this is an area I've kind of moved in. So I'll be using this paper as an example as we go through today's session. But as mentioned, you can look at other things. So you can look at something like prevalence, for example. So this was quite a popular and highly cited review we did on the prevalence of factors associated with polypharmacy in long-term care facilities. So that was my PhD student, Natalie, who led that. And then another one was looking at the prevalence of analgesic use and pain in people with and without dementia in aged care facilities. Okay, so there's some examples of other sorts of research questions you could ask. So I guess we have to go back a step and say, why? Why do we want to do a meta-analysis? Well, the decisions we make about using particular interventions or the validity of a hypothesis can't be based on one single study. Often we need to look at a whole range of different studies and try to synthesize the information together. So we can do things like narrative reviews or literature reviews, which Elida said, but there are limitations to conducting these, as Elida mentioned. These are largely subjective, and it's quite impossible to combine sort of large numbers of studies in this manner. So meta-analysis allows us to use objective formulas to apply to these sort of any number of studies to reach our conclusion. So some of the potential benefits of using a meta-analysis include that it helps to increase power. So you can imagine that by combining all these studies together, we're increasing effectively the sample size that we have. And so we can increase the power to detect some sort of statistically significant difference. By increasing the sample size, we're also going to improve the precision. So we're going to get much more precise estimates with those narrower confidence intervals. Meta-analysis can also help us to answer questions that might not be posed by the individual studies. So individual studies tend to be very narrow. So they tend to be very focused, very selected populations and interventions. By combining several studies, although they might not be exactly the same, we can kind of reach a sort of average idea of the impact. Also, a lot of studies on things like adverse, if we want to look at things like adverse events or things like that, they might not be the key reason that a study was conducted. So they could be a secondary outcome. So by combining multiple studies, we can look at these sorts of secondary outcomes as well. Another good thing with meta-analyses is they allow us to settle controversies that might arise from apparently conflicting studies. So if we have some study which is showing a positive effect and something showing a negative effect, we can kind of combine multiple studies together to see what the actual overall effect would be. And then it can also help us generate new hypotheses. So why were these studies conflicting in their results? What are some of the reasons behind these inconsistencies? So that's where we bring the idea of heterogeneity and think about why this could be. So just to give you that example, so the dry mouse study, so some of the benefits of doing a meta-analysis here was that it helped to increase power and improve precision because we looked at clinical trials, and clinical trials often have small numbers of participants. So we're able to combine multiple clinical trials to improve our sample size. We can also answer questions not posed by individual studies. So as mentioned, dry mouth is an adverse effect. So this isn't often the primary outcome of RCTs. So we're able to look at this more closely. But beware. So meta-analyses sound really great, offer lots of advantages, but we have to be careful. So with any sort of statistical synthesis methods, we're not guaranteed that the results of the review are valid. So moreover, with any tool, statistical methods can be misused. So remember, I like this diagram, garbage in equals garbage out. So the quality of the information you're putting into your meta-analysis will determine the quality of your meta-analysis findings. So the quality of your studies, the quality of your research question, all that is going to be very important. So as Elida mentioned, you know, assessing the quality and risk of bias of studies is paramount. And not every systematic review requires a meta-analysis. So in most cases, having reached the point of qualitative synthesis of your systematic review might be enough. You might not need to do some sort of statistical analysis. It might not make sense to combine studies. So don't think that because you're doing systematic review, you have to do a meta-analysis. That's not usually the case at all. So how do I do a meta-analysis? So I'm just going to talk very broadly about some of the general principles of conducting a meta-analysis. So essentially, meta-analysis is composed of two stages. So in the first stage, you are generating a summary statistic for each of your studies to describe the observed intervention effect in the same way for every study. Okay, I'll go work through an example to illustrate this. And then the second stage is when you're doing a summary or combined intervention effect estimate as a weighted average of the intervention effects estimated in each of these individual studies. So you've done it for each of the individual studies, and then you're going to combine them all to get this sort of average weighted effect. And this is just a sort of general formula for the generating that weighted average. So it's equal to the sum of your estimate for each of the individual studies times each of the individual weights. And the weights are based on the error around the estimate, which is based on the sample size. So you'll see, I'll show you later, but generally the largest studies tend to have narrower confidence intervals and they contribute a higher weight, and you divide them by the sum of weights. So let's work through an example because all that just probably didn't make sense when I just said it. So let's look at the example of medications that cause dry mouth. And we'll focus on one component of this, which was urological drugs, because you can imagine certain urological drugs have anticholinergic properties and are more likely to cause dry mouth. So the studies that I included were studies that looked at urological drugs as an intervention, comparing to placebo, and causing an adverse effect of dry mouth. And dry mouth was dichotomized as yes or no. So this is the sort of information that we might have. And I'm just going to focus on this top part, which looks at tolterodine. Okay, you can see here that there's different urological drugs. So there's tolterodine, oxybutydine, fesoterodine. But I'm just going to talk about tolterodine for now. So this is all our studies on tolterodine. So we had 4 studies here. And in step 1, what we want to do is generate a summary statistic for each of these studies. So let's look at the one in the red box. So let's look at Chong et al. So Chong 2011. So you can see here that we have information about those who use urologicals. So in total, we had 50 people using urologicals and 7 having the event. So the event is dry mouth. Then we have here a total of 87 people using placebo and 5 having the event. And we generate this odds ratio. So I don't know, I think most of you probably know how odds ratios are calculated, but very briefly, we need our 2x2 contingency table with our outcomes and our exposures. And we have our formula for an odds ratio, which is essentially the odds in the exposed divided by the odds in the unexposed. And we have our formula. So we just plug in the values really, and we generate an odds ratio of 2.67. This was just to prove to you that it can be done, but you don't need to do all this. The computer does it for you, but I just wanted to demonstrate. So yeah, we do indeed get an odds ratio of 2.67. All right, so then we repeat that for each of the studies in step 2. So what you can see here is that I've done it for each of the studies, and then we've got a summary one for tolterodine as a whole group. Okay, so on average, it's this. I won't go into details about how to calculate this because the computer does it for you. But basically, you generate an odds ratio. So what I do is I've got the summary statistic for tolterodine, and then I can repeat it for each of the different drugs within the class. And then what I get is this overall estimate for urologicals, so 5.91. So we can say that for urologicals, that the odds of causing dry mouth is 5.91, higher than placebo, okay? So that's basically it. That's what a meta-analysis does. But I think what we might like to do is we might like to look at something a bit better, right? Because looking at numbers it's not very nice. So we want to look at some visuals. So the best way to illustrate a meta-analysis is to conduct what we call a forest plot. So this is our example before for tolterodine, and this is a forest plot. So I'll just briefly go through how you read or interpret a forest plot, because this will be useful for when you're reading meta-analyses in the literature and things like that. So forest plots are made up of a few different things. So each of these dots or squares, these blue squares, represent the point estimate for each study. So when I say point estimate, I'm referring to the odds ratio. So here, this aligns to 2.67 on this scale. Just be aware that this scale is a log scale. So that's why it's kind of goes 1, 10, 100, 2.6. And then this line represents the confidence interval, and it spans from the lower confidence interval, which is 0.80, to the highest upper limit, which is 8.91, okay? That's what it does. And you do that for each of the studies. And then the diamond represents that pooled odds ratio or pooled estimate. And that's kind of after you've kind of combined everything, weighted it all, and you generate this. And the way the diamond is interpreted is that where the sort of vertical line runs through it, that is the point estimate. So that's 4.82, so 4.82. And the width of the diamond is the confidence interval, okay? So 3.25 to 7.15. What you notice in most studies is that the diamond is usually quite narrow. And that's because if you think about it, you're combining all these different studies, so all their sample sizes. So you're going to have this pooled estimate, which is made up of a much larger sample size. And so it has more precision and narrower confidence intervals, so it's smaller. Something else to be aware of, I'll talk a bit more later about this in my talk, is about heterogeneity and overlap. And what you can see here, you'll notice is that all the confidence intervals for all the studies kind of overlap. So what that indicates is that there isn't a lot of difference between the studies. So the heterogeneity or the inconsistencies in the studies is quite low. And you can look at like the I-squared and other statistics to see that. So that was 0%. Okay, so it's very low heterogeneity. I'll talk about that later. And here we just have it as part of our whole neurological drugs. So the top was tilteridine, which I just showed you, but we've done it for each of those. And then we generate this sort of overall one for urologicals. So that 5.91, we have that diamond there. Something else to mention, which I didn't do before, was that for odds ratios and risk ratios, we always look at whether they're above 1 or below 1. And if you recall, the ones above 1 favor, in this case, the urological, so favor getting an adverse effect. Whereas if you go to the left of that, it's favoring the placebo. Okay, so it's less likely to cause dry mouth than placebo. Here I've just got another example. The reason I want to show this example, it's a little bit easier to see, is the size of the square. So I didn't mention it before, but the size of the square tells you how much weight is given to that study. So as I mentioned before, usually larger studies contribute a larger weight. So if you can see here, this study, you know, had quite a lot of people in it and it contributed about 29%. But something like this, a very small square, you can't even see it, only contributed a smaller number of people. So that's why it has a much smaller percentage weight contribution, 2.2%. You can also see that the confidence intervals are very wide as well, which shows the lack of precision. So yeah, that's basically it. So I'll move on. So which effect measure should you use for doing meta-analysis? So there's a few things you can look at. So I was talking a lot about odds ratios before, but the type of effect measure you use depends on the type of data you have. So is it dichotomous? Is it continuous? So you need to be able to choose a suitable effect measure for your meta-analysis. So things you need to consider include things like consistency. So how's it reported across the different studies that you have? Not every study will be perfect and report, you know, the odds ratio that you want or the data that you want. Oftentimes you need to go and contact the author to get further data if possible. So there's things like that. You need to consider the mathematical properties. So what makes sense? So for example, dichotomous data will make sense to use an odds ratio rather than a mean difference or something. And ease of interpretation. So you got to think about your reader, what makes sense to them. So things like odds ratios and risk ratios are generally more easy to interpret compared to other measures. So you could use those. So you need to just think about what is suitable. Having said that, you can report things multiple ways. So for example, you could report things as odds ratios or risk ratios in your forest plots and things. But when you're describing things in a text, you might talk about an absolute risk difference or something like that. So just to give you some examples, so for dichotomous outcomes, here we've got odds ratios again. You can see how that works here with this forest plot, and I showed you one before, so I won't go into too much detail. But things like continuous outcomes, we can report things like a mean difference or standardized mean difference. So here, this is just an example. This is from my PhD meta-analysis looking at pharmacist interventions. Here we're looking at their effect on blood pressure. So it's made up of a few different things. So we have here, this diamond represents diastolic blood pressure, and here we have systolic blood pressure. But what you can see on the scale is that in the middle, we have 0, so that would be no difference. But then we have -6 and -12, or +6 and +12. So say, for example, with our systolic blood pressure, we see that our diamond is here, which is -5.72. So what we can say is that it has an average effect of reducing blood pressure by 5.72 millimeters of mercury. Okay, so that's the mean difference between intervention and control. Okay, so that's just an example of when, if you have continuous data, you can still do these forest plots. So next is, when can I do a meta-analysis? So a meta-analysis can really only be performed when you have a group of studies which is similar. So you might have come across the term homogeneity, and that just means there's similarity across the studies, because it only makes sense to combine studies which are similar. So you need to consider, at the very least, that studies should be homogeneous in terms of their participants, the interventions, and the outcomes, because you want to be able to draw meaningful conclusions, okay? So you can't have them all very different, because then it won't make sense to combine and you can't draw out anything from it. So this gives us the idea of heterogeneity. So any kind of variability among studies is referred to heterogeneity. And so we need to consider a few things. This can include clinical diversity, so where participants, interventions, and outcomes differ between studies. There's also methodological diversity, where there's variability in the study design. So if you had RCTs and observational studies and things like that. And statistical heterogeneity is where the observed intervention effect differs between studies because of chance, okay? So it's important to measure and address heterogeneity in your review because it affects the extent to which you can rely on the conclusions you draw. So to illustrate this with an example, so going back to our dry mouth medication example, so we tried to reduce clinical diversity by having a focused sort of population. So we had older people aged 60 years and over. We looked at interventions, so in this case, use of urological drugs. Notice here that I did also look at other classes of drugs. So I looked at, say, antidepressant drugs or psychotropics or whatever, but I didn't combine them to urologicals because I thought they were too heterogeneous. So I just focused on urological drugs here. A placebo was our comparator, and our outcome was dry mouth. And for reducing methodological diversity, we included only placebo-controlled RCTs. Okay, so it was a very well-defined study method. And by doing this, we reduced statistical heterogeneity. Okay, so basically what you want to do is you don't want to combine apples and oranges unless it makes sense to combine apples and oranges. So what I mean by that is that if we're doing a study and we're interested in apples, it makes no sense to combine apples and oranges because that doesn't make sense. Like oranges aren't going to contribute any information about apples, are they? So that's not meaningful. But if we're doing a study about fruit, then combining information about apples and oranges makes sense because they're both fruit and we can get a better understanding about the average effect of fruit. So it would be meaningful to combine. So to illustrate this with a sort of pharmacy example, a meta-analysis may be reasonably used to evaluate the average effect of a class of drugs by combining results from trials where each evaluates the effect of a different drug from the class. So I can combine drugs like tolterodine, oxybutadine, fesoterodine, etc., because I'm interested in the average effect of urological drugs. Okay, so that makes sense to combine. So I guess the next thing is to think about, well, how do we actually identify and measure heterogeneity? I won't go into too much detail, but there's a couple of statistics you can do. So there's generating, there's a tau statistic, there's a chi-squared statistic. Looking at the p-value for the chi-squared will tell you whether there's any differences between the studies, so any statistical heterogeneity. But a common statistic to use is the I-squared statistic. So the I-squared statistic assesses the impact of heterogeneity on meta-analysis by quantifying those inconsistencies across studies. Now, there's no right or wrong way to say what a cutoff is appropriate for I-squared statistics are. This is a very rough guide, okay? Where we might say, you know, it might range from, you know, 0 to 40%. So heterogeneity is not really an issue, up to like 100% where there is considerable heterogeneity. So just looking at our example before, what we saw for tolterodine, for example, is that looking at the chi-squared statistic, the p-value was greater than 0.05. Sometimes we use a more strict or less strict cutoff. So we might say P greater than 0.1 instead of 0.05. But looking at the I-squared, so we can see that it's greater than that. So there's no differences between the studies. And the I-squared is quite low, so it's 0%. But after combining this, we see that there is some heterogeneity across the studies. So, 62% for the sort of overall one. Okay, so that's just to illustrate the heterogeneity that might exist across studies. So how do we actually address heterogeneity? So we have a few options. If there's very obvious heterogeneity that we can't pinpoint, like it doesn't make sense, so we might need to check again that our data are correct. If there's very substantial heterogeneity, then don't do a meta-analysis. There's no point doing it. It doesn't make sense to do it, so we might just not do it. We may explore heterogeneity further. So there's ways to do this. These include doing subgroup analyses. So for example, we might restrict it to certain quality of studies. So we might only look at high quality studies in our meta-analysis, or we might think that there's, geographical differences. So we only look at certain countries or whatever it is. So we look at underlying factors for why what's driving that heterogeneity. Another thing we can do is meta-regression, which is similar in that if it looks for those predictors of heterogeneity in our meta-analysis. Number 4, we can ignore the heterogeneity. That's probably not a good idea, but I mean, if the heterogeneity is not that bad, we might choose to ignore it. We can perform a random effects meta-analysis. I won't go into this, but it's just another method we can use. We can reconsider the type of effect measure we've used. So was an odds ratio appropriate? Should we use something different? And we might need to exclude studies. So for example, I was saying like if they're poorer quality studies, things like that, it might be appropriate to exclude. But just be careful because once you start excluding things, you tend to introduce a bit of bias into your meta-analysis as well. So these are just some things that you might consider. So how do we actually go about this and what sort of software can we use for conducting meta-analysis? So I know I showed you all those calculations before. You don't need to do any of those by hand because the software will do it for you. So there are some specific meta-analysis software. A popular one, which I use, is Review Manager or RevMan. This is free and available for download online. It's through the Cochrane people, so it's pretty good. There's lots of tutorials and workshops and online resources for it, so give that a go. Another one which you can pay for is comprehensive meta-analysis software. This is very, very user-friendly. It kind of walks you through step-by-step what to do, but you've got to pay for that one. But there is a trial version, so you could give that a go and see if you like it first. Statistical software can do meta-analysis. I've not had experience with this, but I definitely know it's feasible. So you can use things like Stata, R, SAS. Usually people post code or plugins and things online, so you should be able to do that if you're competent in using these software. Excel can even be used for meta-analysis and generating forest plots. It's a little bit tricky, but it is possible. As mentioned, lots of resources online. So don't worry too much. I'm sure you can work out how to do this. But also don't be afraid to ask for help. So consult people like statisticians, people in your research office, people, librarians who have experience with that. Also just reach out to your colleagues who've had experience conducting this. Yeah. So who should do a meta-analysis? So lots of different people use meta-analysis. So for example, pharmaceutical companies use meta-analysis when they're trying to get drugs for approval. Policymakers, people working in government use meta-analysis and systematic review. People like yourselves, so clinicians or applied researchers in the health sciences use meta-analysis because these help to guide clinical practice. They tend to inform clinical guidelines, things like that. But even in the basic sciences, people use meta-analysis and systematic review to evaluate the sorts of existing evidence which is out there. So within the research process, meta-analysis can be used as an end product in itself. So it can be a publication in a journal, but it can also be used for things like planning new studies. So you might use it to identify what gaps there are and what's needed. Also good for grant applications to show what's existing and how your planned project is going to solve another problem or whatever. But for today's presentation, I guess we're interested in publications, and I think this leads on to quite nicely to the next part of my talk, which is about publishing in high impact journals. But before I go straight into that, I think it's good to take a step back and think about what we're doing and why we're doing it. So the first thing you need to do is you need to establish your own priorities. So you need to think about your research and who is your most important audience for your research. So who's going to benefit from this? So the people I'm talking to today are different stages of their career. So some are, starting out, they're just undertaking their PhDs. Others are working in academia or other places. So I guess you got to think, are you aiming to build an academic track record, or does your research have some sort of impact outside of that? So working in a government setting or working in industry, how will that influence it? Or how does it influence the general public? So the patient or the public. And you've got to think about your own discipline. So I'm talking from sort of pharmacy practice, but you might be working pharmaceutical sciences or medicine or nursing or some other sort of discipline. So you need to think about what are the common publishing conventions in your discipline. So it could be journal publications, but it could be book chapters or conferences. That's the more normal way to do things. Like, it just depends. So have a think about that. Also, does your research funding come with open access requirements? So nowadays, open access is becoming a more popular way to share your research. Some grants and things have funding set aside for publishing open access. So just have to think about that, because that might tell you what journals to aim for. And what are your short and long-term career goals as well? So are you really trying to build up that academic track record, or are you trying to influence the public and, things like that? So just have a think about what your career goals are. So consider your audience. Who benefits from your work? So identifying any sort of current or potential audiences helps you to refine your objectives and come up with a plan for engaging with them. So engaging with your audience. So potential audience members can include other specialist researchers. So for me, it could be other researchers in geriatric pharmacy or something like that. But it could be researchers from a more broader field. So I could be targeting sort of just general pharmacy researchers or medical researchers or whatever. Practitioners, so it could be medical practitioners or pharmacists or whoever it is. Other educators, could be more broader community groups, companies, industries, the general public. So have a think about who your potential audiences are. Which audiences you prioritize will depend on your career stage and goals, as I said. So are you aiming for recognition by your peers, looking for future collaboration opportunities, aiming for commercialization, or influencing practitioners' behaviors? So you can imagine each of these are different types of audiences, and the way you present or disseminate your research will govern, how you do that. But having said that, you can obviously have more than one audience, okay? So you might want to publish in a scientific journal so that your peers in research can access it and build from that. But you might also go and outreach to patients and to GPs about your research and how that might influence practice. So that's perfectly fine as well. So I guess one of the things we want to think about is, well, how do I choose the right journal then? Like, I'm interested in publishing in a journal. I've got my systematic review and meta-analysis done. Which journal do I choose? So finding the right journal always comes back, as I said before, to your target audience. So you need to take into consideration the type of article you'd like to publish, the aims and scope of the potential journals that you're going for, and evidence of the journal performance. So what's the quality of the journal? What's its reputation? How's it doing? Okay, so some things you can think about to identify journals with a relevant scope. Think about which journals you read and cite. So I'm sure off the top of your head, you can list, 3, 4, or 5 journals that you're familiar with, that you read, that you've seen your colleagues publish in, that you publish in. This could be a lot of sort of pharmacy practice journals, for example, or say for me with my dry mouth study, my dentist colleagues have their journals, so they refer to. So just have a think about what your network of people, what they tend to publish in. And speak to your colleagues and supervisors about the journals that they read and recommend, because they have much more experience and they will know what sort of journals to aim for, which journals you should avoid. Okay, so make sure you speak to your supervisors and your colleagues. You can also search key databases in your field. to see where research has been published previously as well. So this could be a sort of more general database like PubMed or something, but you might have more specialty databases depending on your field as well. And a good way is to browse for journal rankings. So how well within a field is your journal doing? I'll talk about this a bit later. And there's different ways to do that. And I'll talk about these later on the talk. There are tools which I have not used, but you can use journal suggestion tools, which will help you find journals based on your title and abstract. So these are possible. I can give you links to this. I've not used them, so I can't recommend them, but that's another way to find a suitable journal. If you're going for open access journals, there is things like the directory of open access journals, which you can use. So we always talk about high impact journals, but what is a high impact journal? What does that mean? So let's take a step back again. So how do we evaluate journal quality, reputation, and reach? So there's a few different things we can look at. So for example, if we're looking at the journal itself and the publisher and its websites, we can evaluate a few certain criteria. So we can look at how does the journal do peer review? Is it a rigorous process? Is it transparent? So they might describe this on the website, but you could also speak to colleagues who've submitted to that journal before, like, is it a proper process or is it a bit dodgy, you know? Are the editorial board members highly qualified, recognizable, and broadly representative of the field? So if you have a quick look of the editorial team of the journal, you might be able to recognize some names, which is good because then you know they're legitimate researchers. So that's always good to check. Simple things like checking that, you know, there's actual contact details for the editorial staff. Is the publisher a member of a particular professional organization, and are open access and self-archiving policies transparent and clear? These are just sort of normal things that a journal should have. So if they don't have these things, warning bells should go off in your head. You can also look at past journal issues as well. So are the articles of a high quality according to your reading? So if you've in your own literature review and looking, have the articles that you've read from that journal, have they been pretty good, you know, of good quality? And do the articles include things like DOI numbers, so digital object identifiers and ORCIDs? So, you know, are they traceable and legitimate? Again, ask your personal networks, so ask your colleagues and supervisors about the journals they think have a good reputation. Also ask, have they had any negative experiences with any journals? So has there been unexpected challenges? Like, has the peer review taken months and months and months for no reason? Or have they, you know, have there been issues along the way? So just check with them. And then there's also other databases you can use. So is the journal available through certain key databases? So is it indexed in PubMed or whatever it is? And you can check disciplinary lists. So for example, your university might have a list of journals and their rankings. And you can also use different journal level citation metrics as well, which I will talk about now. So journal level metrics. So metrics are becoming a big thing now. I don't know about in Indonesia, but in Australia, everyone's talking about metrics and how well what your ranking is for this and that, and you know. So let's just go through it. Metrics are good. They're good and bad, obviously. But in terms of things like when you're applying for, at least for example, for me, when I apply for a fellowship application, I need to say what percentage of my papers are in X Q1 journal, blah, blah, blah. You know, you got to say it like that. So it's good to be familiar with this. It's a lot of information, but let's just kind of go through some of these. So publishing, well, it comes back to why do we want to publish in these journals? Well, publishing in impactful journals increases the likelihood of your work being used and cited. So you can imagine with your own work, like if you see two papers, right, and they both come with the same conclusions, one's in the Lancet and one's in this random journal you've never heard of, you're going to cite the Lancet, of course, right, because it's more prestigious and you can include that in the introduction of your paper or whatever. So they tend to be more highly cited and used. Another thing is systematic reviews and meta-analysis are very highly cited. If I was to show you my publication list and my citations, all the systematic reviews are the ones getting citations in the hundreds just because everyone cites them in their papers. So that's another reason to do a systematic review and meta-analysis. So citation-based metrics can be used as an indicator of the academic impact of a journal, particularly in the health sciences. And journal level citation metrics calculate the number of citations to articles published in a journal over a given time period. So to give you an example, let's look at how a journal impact factor is calculated. I'm sure you've all heard of impact factor. And so, for example, if I was calculating the 2008 journal impact factor for a particular journal, the way it's calculated, it's based on the previous 2 years. So what I do is I get the number of citations from 2007 and 2006 and add them together. And then the number of items published in 2007 and 2006 and add them together. And all I do is I divide a number of citations in the last 2 years divided by the number of items published in the last 2 years. And you get that impact factor. So that's how it's calculated. So it's a ratio of citations to articles published. So the more citations that journal gets, then the higher the impact factor. So journal impact factor is just one type of metric. There are a range of other metrics available that draw on different sources of citation data and adjust for different considerations. Because of this, it's important that you consider multiple different metrics. So not just one metric, but a few other metrics as well. Now, while journal level metrics can indicate the prestige of a journal overall, article level metrics better indicate uptake of your specific article. So for example, for fellowship applications, you're probably more interested in your own work. So how has your particular research impacted the academic community? So there are ways to generate article level metrics through SciVal and Scopus. I won't be talking into too much detail about that, but I encourage you to speak to your research office or whoever to help you out with that. But today I'm just talking about general journal metrics. So some limitations of these metrics are that you can't really compare journals across disciplines, okay? So you can imagine there's so many different disciplines just within medicine and pharmacy. You know, I tend to publish more in geriatric journals and things. So it doesn't make sense for me to compare geriatric journals to pharmacy practice journals, for example, because they're ranked differently and the metrics are different and it doesn't make sense. So just be careful. Don't compare, you know, the top journal in geriatrics to the top journal in pharmacy practice, because although they're the top journals, it doesn't make sense because one might have a very high impact factor whilst the other doesn't. So it's all discipline specific. All metrics have limitations and should be used in an informed manner and only as a complement to other evaluation methods. So don't just rely on their journal metrics. Make sure you think about the broader picture and other measures as well. In some disciplines, citation metrics do not provide reliable evidence of impact, okay? So impact can be measured in different ways, and impact is a very big thing. At least in Australia, everyone talks about research impact. You got to write about how your research has impacted whatever. Journal citations and all that is just one part of that. Another part is like, you know, how have you influenced policy? How have you influenced practice? Like, so think about that more broadly as well. Journal metrics supplement the advice provided by your advisors, so your supervisors and colleagues, about the reputation and reach of journals in your field. So always seek help from other people, not just a journal metric. So here I've just got a table which shows you some of the commonly used journal level metrics. I'll just talk about a couple of these today, with the ones which I'm a little bit more familiar with. So I guess journal impact factor. So that's probably one of the more common ones. So I talked to you about how that's calculated. You can access this through Insights. I'll show you this later. So that's a website which has journal citation reports and tells you about journals. As mentioned, these aren't field weighted, so they don't tell you how it ranks within the field, but it's just an overall metric. And it's calculated over the 3 years. Another common one is SCImago journal ranking. So this ranks journals and it is field specific. So it tells you within that particular discipline where the journal is ranked. And I can show you an example of that. And there's these other ones which I haven't really used, but they're just sort of the same sort of thing, looking at citations and how they calculate some sort of score. So these are other things that are available. So the source normalized impact per paper, site score, 5-year impact factor. Yeah, there's some other ones, but these are probably the more common metrics. So as I mentioned before, Insights is good. It has information about individual journals. So if you recall the example of the dry mouth and medications, we published this in the Journal of the American Geriatric Society. So here I've just put it up. It's got some information about the journal. You can see the journal impact factor and its trend as well. How it's calculated, the items that contribute to the GIFs that are highly cited papers. Also here, I haven't shown you it, but it's got some other information. So it's got stuff about ranking and things like that. So what I suggest is go to this and then plug in your journal and just check how it looks compared to other journals as well. This is the Cymago journal ranking. So this is what I use for when I want to rank journals within the discipline. So for example, within the discipline of geriatrics and gerontology, these are like, here I've got the top 8. So Journal of American Geriatric Society is probably number 7, but that's out of 109 journals. So that's actually a really good journal. So the difference is Cymago, I don't know how they decide what journals belong to what disciplines, but I noticed that Cymago, there was more here compared to this. I think it was ranked out of 50 journals or something. So obviously it looks better when it's out of here. So when you're writing up your fellowship applications or things, if they allow you to quote, get your metrics from different sources, just think about what one looks better, I guess I'm trying to say. So, and these are legitimate rankings and resources. So you're not biasing anything. So yeah, so that's Cymago journal ranking. And this is just part of that as well. These are all different things you can look at about the journal. Something I like to look at is it a Q1 journal? So is it the top 25% of its discipline? So I try to aim for that if possible. Okay, so now that we've talked about high impact journals and how we can find out if a journal is of good quality, how do we actually go ahead and publish in those sorts of journals? So here's just some tips which I've drawn from the internet. So I've got some tips from different editors of journals and from people who've published about this. So these are thoughts from different people which I've combined together. So how do you do this? Well, the first thing you have to do, no matter what you do, is you have to do good research. So no matter like what else you do, no matter, it all comes down to the research you do. So make sure you have a very good research question and method, and you do everything properly. That's the number one thing. You can't replace good research with anything else. Formulate an important research question. So you want your research question, so whether that's for your systematic review or whatever other study you do, you want it to be clinically relevant and important. Okay, you want it to be useful. You want people to think, oh, wow, I'm really interested in that question and the answer, so I'm going to go pick up that paper and read it. So it needs to be important. Often cases, it needs to be novel as well. So it has to be something new. You don't want to just do the same old thing again. If possible, do something which adds a different angle to a particular problem or whatever it is. The next tip is do not work alone. Research has moved away from people working in their individual silos to working as part of larger collaborative teams. I think this is important, especially when you're doing a systematic review and meta-analysis, as Elida alluded before. You need people to independently assess do the data screening and data extraction, quality assessment should be done independently by another person. So you can't work alone. You need to involve other people. But also don't just involve people from your own discipline. Try to reach out to people outside your school. So for example, with my dry mouth paper, I was working with my Swedish colleagues who were dentists. So I was working with geriatric dentists, I was working with geriatricians, I was working with statisticians, you know what I mean? So work with people outside your discipline. I brought the pharmacy perspective. So work with a diverse range of people if possible, because this will only strengthen your paper. Have a sound study design, okay? So this, this goes into, doing good research. Make sure you have a sound methodology for doing your work. So as mentioned before, make sure you're able to follow essentially the PRISMA guideline. You can also consider registering your protocol with Prospero, as mentioned before, and submit that a priori, so before you've finished your systematic review, basically, because this can add an extra level of credence to your study as well. When it comes to writing your manuscript, make sure you write in a very clear way. So you should have a clear structure and flow. And it should essentially tell a story. So your reader should be able to read your paper and make sense of it as they're going through. Your paper should be well signposted. What I mean by that, it should have clear subheadings and clear sentences to start off with so that the reader understands what's happening. So you can always use the PRISMA checklist to make sure you've reported on everything you need to do. There's a logical order. Also check the journal guidelines because they often have advice on what the subheading should be and things like that. So make sure you do that. Importantly, make sure your manuscript is readable and doesn't contain any sort of spelling or grammatical errors. So make sure it gets proofread, not just by yourself, but also even people not directly in your team. So if you get someone who's not works very closely with it, they can offer a sort of outsider point of view to pick up any sort of errors. If you need assistance, specifically with the English language, because there's wording and things which might be difficult, you could get a native English speaker to read it, for example. Importantly, you need to have a strong title, abstract, and cover letter. I'll be talking about this next, because these are the first things that the editor reads, that the peer reviewer reads, that the reader themselves reads. So it needs to really be really strong and good from the start, okay? Because you could technically get rejected at the desk by one of these things. And make sure you follow the journal formatting guidelines. Now, I know some journals have relaxed this a little bit, so you can submit a more generic manuscript to some journals, but just read the guidelines carefully because often they require you to have certain formatting and things. And I know it's very time consuming, and once you get rejected, you've got to submit to the next journal, you've got to reformat everything. That's just unfortunately a thing that you have to do. So just make sure you do it properly and use proper things like referencing software and things like that to make sure the references are formatted and everything like that. Also target the right journal. So I know we always talked about high impact, but be honest with yourself. Think about the quality of your work, think about your discipline and what would be a suitable journal for your paper. So although Lancet's the best journal, whatever, or New England Journal of Medicine, there's no point submitting there if you don't think the quality of your work would be suitable for that journal or for that readership. So you should aim for something which makes sense to you. So it's important to aim high, but not too high, is what I'm trying to say. Okay, so just a couple of websites you might check out for when you're doing your systematic review meta-analysis. So as mentioned, you can register your protocol with Prospero if you think it's required. Check the journals. Some journals might want you to register with Prospero. Others don't necessarily say you have to. So just check if you need to and if you think it's good to. So here I've just got the one we submitted for our dry mouth paper. So that's just how it looks. It's very straightforward to do. So just go on the website. Here's the PRISMA checklist. So Elida's already talked about this, but you got to make sure you're able to tick off each of these items and you can say where it occurred on the page. So do this for your own good so that you're making sure you report it as you need to. But some journals actually require you to submit this as well. So just check that as well. So you might need to submit this. This is the first page and there's a second page after this as well. So I mentioned a few things that you should have. So a strong title. As mentioned before, this is the first thing a reader sees. So it needs to be something that catches their attention, accurately describes the contents of your manuscript and makes people want to read further. So there needs to be a balance here. These tips were from other editors and things. So see if they apply to you. I'm just reading them out. So focus on the novelty and include one key message. use action verbs to make the title clear and lively, and avoid generic words. So like on the study of, investigation of. So try to make it a little bit more exciting. Before I forget, make sure your title isn't too long, because if it's too long, it becomes a little bit clumsy and difficult to read. But obviously don't make it too short, because then it might not convey enough information. So make sure you have a balance. Journals also often specify how many characters for your title, so just be aware of that as well. Avoid acronyms that are unfamiliar to your intended audience. So if it's an acronym for a trial or something, that's usually okay, because you're spelling out the trial. But if it's just some random acronym which not many people would know about, probably try to avoid it if possible. And also avoid sort of overly technical or specialized jargon in your title. Now, this next point I don't necessarily agree with, but it says avoid use of punctuation, including split titles with dashes and colons, unless they are essential. So I think it's up to you. I think for something like a systematic review of meta-analysis, I think it's fine to do this. So, you know, like I think mine was like medications that cause dry mouth, ... a systematic review of meta-analysis. I think that's fine, but some people, I think for more like maybe for a clinical trial or whatever it is, like they might say not to do that, but I think it's okay. Next, although puns, plays on words, and amusing metaphors might work for like literature or narrative review papers, do not use them for research papers. I kind of agree with that. I think your research should be serious. So just have a title which is clear and makes sense. These sorts of puns and plays on words, I think they're nice for when you're giving an oral presentation or something like that. But I think for research, try to keep it a bit more like a standard sort of title. This one, I'm a bit like, it's up to you, but they say to avoid question marks in the title, because authors should be providing answers, not asking questions. So I've been guilty of this. I've probably done one or two papers where I put a question mark. I thought it sounded good, but some people try to avoid that, because you want it to be more like I'm going to solve this question rather than to raise a question. So these are just some generic tips. Pick and choose what you think works for you, okay? Next is you need to have a strong abstract. This is very important because, again, this is like sometimes the only thing that the editor reads or the reader reads. So essentially what you need to think of is that the abstract is a mini version of your paper. So it represents like a guide to the most important parts of your manuscript. And as mentioned, many readers and editors only read the abstract. So you need to be able to stand alone, okay? So make sure you don't refer to results sections or tables or figures in your abstract, or don't put references in your abstract. It should just be able to be read alone, okay? So the reader has to be able to pick up the abstract and just read it and understand it clearly. Now, I think it's important that your abstract answers these key questions. So what was done? Why did you do it? What did you find? Why are these findings useful and important? And what is the take-home message, okay? If you can answer all these questions in your abstract, then I think you have a perfect abstract, okay? So make sure you answer all these questions in a clear, concise manner. Again, follow the proper manuscript, the journal manuscript formatting guidelines. Generally in the sciences, we have a structured abstract, you know, background, aims, methods, results, conclusions. But some journals differ. Some might have an unstructured abstract. Some have a more structured abstract, so they might say setting, participants, measurements, blah, blah, blah. Just follow whatever the guidelines say. And be careful of the word limit. In general, it's around 250 words. Some are longer, some are shorter. But I would say aim for around 250 words. Apparently, this is the maximum that would appear on indexing services. I wasn't aware of that, but apparently that is. So it's good to keep it more concise. I guess also, like if you're finding that, you know, if you get rejected from different journals and things, it's good to not have to keep changing your abstract. So if you keep it around 250, it's pretty standard. Again, try to use sort of action verbs and active constructions because these tend to be more effective than passive ones. So instead of saying it was shown, say the study shows or whatever, you know, try to make it more active. Avoid obscurity. So you really don't have a lot of words to play with, and you need to make your abstract understandable from the first read. So you need to be clear and concise. Because the last thing you want is the editor to read through your abstract and go, oh, what did that mean? I have to go back and read it again. Because then, you know, that's not going to be very good. So make sure you have a clear and concise abstract. Now, the cover letter. I've heard mixed things about cover letters. I've spoken to editors of journals where they say, oh, the cover letter doesn't really matter that much as long as you say, you know, these key things like we haven't published elsewhere and or the authors approved the manuscript, blah, 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 like that's fine. Others use it to screen your paper and see if it's, you know, they should actually move on and read the abstract. So I think it depends. So I will just do it properly. So the cover letter needs to sell your paper. So just think of it, you've done this great piece of work, but you need to be able to sell it to the editor so they buys it and puts it in the journal. Okay, that's what you're trying to do. So you want to be able to attract the editor's attention and provide a clear rationale for sending your paper out for external peer review. So you need to highlight things like what's novel about your work and why the journal readers will want to read it and think it's important. Okay. I always use the words, whenever I write a cover letter, I always use the word novel or innovative. Okay, even if it isn't really novel, just use the word and try to spin it so that it is. And always think about the journal readership. So you might say something like, we think this, so say I submitted it to Journal of American Geriatric Society, I could say something like, you know, this novel or innovative study shows that X, Y, Z, blah, blah, blah. We think this will be of interest to your journal reader. We think this will be interest to geriatricians, pharmacists, blah, 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 who, and other readers of your journal, you know, something like that. So they can kind of see who would like to read your paper. Obviously avoid careless mistakes, okay? Because I think I've peer reviewed and seen careless mistakes and I'm just like, oh, it's such a turn off. So make sure you don't have spelling or grammatical errors. So make sure you proofread your letter as well as your manuscript. And things like addressing it to the correct editor, and making sure you use the right journal as well. I know because if you get a journal rejected, you try to recycle the cover letter. Make sure you put in the new journal that you're submitting to, so it's the correct journal. So I mentioned saying it's novel, saying who the readers are, indicate why this is a good fit for your journal's remit and scope. So yeah, if it's about geriatrics, then I would focus more on the geriatric side of things. If I was submitting the same paper to a dental journal because it was about dental outcomes, I would highlight that. I'll try to say, oh, it'll be good for dentists because they're practitioners, blah, blah, blah. So try to tailor it to your audience. So your audience is the editor of that journal. So you got to tailor it to that audience. And with all cover letters, you need to say that, you know, we confirm that the manuscript hasn't been published elsewhere, was currently under consideration by another journal. So never submit your paper to multiple journals at the same time. That's like bad etiquette and you shouldn't do that. Also make sure all your authors have read and approved the manuscript as well, okay? Okay, very briefly, again, I didn't come up with these. I read this from some other people, but some reasons for instant rejection. So when we say instant rejection, we mean it's gone to the editor and the editor says, it's not worthy of this journal. I'm not going to send it out to peer review. I'm going to reject it. So that's what we mean. That's like a desk rejection. So an instant rejection. So the main reasons are it's inappropriate for the journal. So it could just be totally not appropriate. It could be outside the field or things like that. So one example, for example, my one of the dental papers I did, it was about dental outcomes in people with dementia. I submitted it to a dental research journal, but they said it didn't really fit them. Like I'm better off submitting to a more specialized gerodontology journal, so a journal about geriatric dentistry, basically. So they suggested that because it wasn't a good fit for them. Another reason is that it lacks novelty. So there's no point for a journal to, you know, republish the same old thing if they don't think it's very novel. So try to think about how your work might be novel and try to sell that. They might reject it because it's a purely descriptive study and there's no real analytical work or anything of substance. It's really purely descriptive. I'm not saying that descriptive work is bad. I'm just saying that some journals, like the higher impact ones, might not see the benefit of publishing a purely descriptive work. So you might need to try somewhere else. As mentioned before, if it poses an uninteresting question, and if that question leads nowhere, then no one's going to want to read that. So you have to have an interesting question. Or it has a poor or inappropriate study design. So if there's major flaws with the study design, if the sample size is really small, if, you know, all these things, then it could be rejected by the journal. Now, say that your editor has thought that, okay, it looks okay, but I'm going to send it out to peer review. These are some reasons why it might be rejected after peer review. So if there's obvious flaws in this design or methods, then it's likely to be rejected. If it lacks novelty, if it lacks a clear message, if the effects shown are very small or incremental, not very exciting, if there's lots of minor points that don't help, if the study's rationale is poorly explained, so there's no what's the reason for doing a study, if the study is confusing, so if you have all these different charts and diagrams which don't make sense, or your figures and tables don't make sense, or if your numbers don't match up and there's discrepancies, then they can be rejected because it looks like you haven't done a good quality study. So make sure you address all these issues before submission. Okay. So I'm going to kind of wrap up this session because I've probably talked a lot already, but just some key take-home messages for publishing systematic reviews and meta-analyses. So as Elida said right from the start, systematic reviews and meta-analyses are considered the highest levels of evidence for informing clinical decisions. So they're very important pieces of work. So they need to be done properly. Because of this, they are very highly cited and they're very impactful. So they're very likely to influence people's decisions about clinical practice, about policy. So to give you an example, where we put in an application to develop guidelines for medication use in dementia, for example. As part of that process, we need to do a systematic review. We need to do a meta-analysis to see what the evidence currently says about the best psychotropic to prescribe or whatever it is. So this really does inform practice because these guidelines will then be used by the prescriber to prescribe a drug. So, you know, it really does have major impact. Choose an interesting, important, and focused research question. Okay, that's very important. Choose a novel question if possible. If needed, you can register your protocol with Prospero and make sure you follow the PRISMA statement and guidelines for when you report or write up your manuscript. So make sure you're able to tick off all those items. So essentially you're demonstrating that you're doing good research. Seek help. These methods are very tricky and they can be very challenging and overwhelming when you first start. As mentioned, the systematic review and meta-analysis was probably the first thing I started my PhD and it was the last thing I got published or finished. So you can imagine how many years that took. So make sure you seek help, and especially if you're a PhD student, use this as a learning opportunity, okay? Because you're going to learn a lot of things. You're going to learn how to do a systematic review and how to deal with people. How do you manage your supervisors, get them to help you read the papers, do the screening, whatever it is. So there's a lot of time management's another thing you're going to learn. So make sure you seek help. Seek help from librarians, statisticians, other colleagues who've done systematic reviews. And take your time. Average systematic review can take, you know, from 6 months to 18 months or longer. So it's very much a process. So take your time, don't rush it. Make sure you have a very good, clear PICO or PECO question, a clear search strategy, you know, all that thing. Make sure you do all the steps properly, okay? Because it takes time. When it comes to publishing, think about your priorities. So think about who your audience is. Think about who your readers are for your research. Think about your own priorities. So what do you want to get out of this? Are you trying to build up your academic track record? Are you trying to influence policy? Are you trying to do all of that? You know, just think about your priorities. And choose a suitable journal. So aim high, but not too high. Choose something within the scope that you think would be suitable for your manuscript. And when you're submitting your paper, make sure you sell your paper. Okay, don't be shy. I know it took me a bit of time to change the way I think, when you're writing a grant application or fellowship application or a cover letter, you can't be shy. You can't say, oh, I think this might be a good study. You got to say, this study shows that this intervention does this. Okay, you got to sell it. You got to say you're the best person to have done this, so you got to sell your paper. Okay. And that's it from me. So thanks very much. Feel free to please email me if you have any questions. That's my email address. You can follow me on Twitter, but I don't really use Twitter, but feel free to follow me. That's my handle there. And thank you so much for your attention.
All right, thank you very much, Dr. Edwin Tan, for giving such complete yet interesting presentation about conducting meta-analysis in pharmacy-related topics and also strategies to publish in high-impact journals. I think it is quite challenging and it's statistical analysis skill to perform, but I'm pretty sure that the strategies that you provide will be very useful for academia, postgraduate students, and researchers who are attending this webinar. Okay, ladies and gentlemen, now we come to question and answer session. I've summarized question in the chat here, and just wait a minute. I will share my screen for a moment. Yeah, for the speakers, Dr. Elida Zairina and Dr. Edwin Tan, are you ready to question and answer session?
Yeah, sure.
Okay.
Yep.
Okay, this one, the first question is from Anisha from Universitas Brawijaya. Can systematic review or meta-analysis be applied to experimental animal research? Do you want me to read like 3 questions or each question and then answer?
I think you just can put it like this, and then Edwin
Okay.
and I are gonna try to answer.
Okay, sure.
Yeah.
Okay.
Okay. Thank you for the questions. For the first question, can systematic review or meta-analysis be applied to experimental animal research? Well, Ed will also help to answer the questions, but I'm going to go for the first thing first. Well, if you are talking about the methods, the review methods, how you select the article, what the database that you are going to use, what's the research question that you're going to design, probably the systematic review methods for the experimental animal research, you can do it. But again, because systematic review and meta-analysis are considered as the highest level of evidence in evidence-based medicine, it means it's applied to humans. Doing the meta-analysis maybe is a bit weird for the animal research. I never seen a meta-analysis paper for including the experimental animal research, because most of the systematic review and meta-analysis were done to answer the clinical questions for patients or for a healthcare intervention. That for the first, probably you want to add something?
Yeah, I have to agree. I haven't really seen it much in animal research.
Yeah.
But I have to say it's impossible. So I'll encourage you, because this is a little bit outside my area, I'll encourage you to have a look. Just go to PubMed, see if any other previous systematic reviews or meta-analysis have been applied in animal research. I think it depends on the sort of question you're asking. But I'd say it's probably not super common, but it's not impossible to do.
Yeah, agree. Well, it's not impossible to do it, but again, probably if there are some research to do, that probably is probably going to the methods is possible to do the systematic review, but again, it depends on the research questions. Bu Geta, should we read the second questions? Just yeah.
Yes.
Okay, so
yeah.
And I think okay. So why? Because we already answered the questions, the reason, and then are the articles selected for systematic review should be homogeneous in all variable. all variable, it means too broad, but for the systematic review, you already decided what kind of the inclusion and exclusion criteria for your study or for your population. You already have decided the PICO question. Mm-hmm. So in terms of homogeneous, if of course you need to have the same populations, you need to have the same intervention, you need at least to have the same outcome. But whether is it heterogeneous or homogeneous, that will lead you whether you are able to do the meta-analysis or not. That was Edwin just explained about the heterogeneity of the study in the meta-analysis. But it doesn't mean that you already have the criteria of your study, the same population, the same intervention, the same outcome measure. It doesn't mean that if you have different interventions, you cannot do the systematic review. You still can do the systematic review, but you cannot just pull it all of the data because it has a different intervention, although it has the same populations. So you can probably just present the data qualitative or descriptive way. You cannot just pulling the data just like the meta-analysis did. Ed, you want to add something?
Yeah, I think that's what you said is correct. So you can only really combine similar studies, but you could look at different things. So you could look at, like you said before, you can look at multiple outcomes, for example. But in terms of meta-analysis, it only makes sense to combine things that are the same. Having said that, say you're looking at dry mouth in different ways. So one was yes or no, one was on a scale. If you're able to logically convert one to the other, then you can combine them. That's the only thing I can think of. Or like a depression scale, like depression, yes or no, and then depressive symptoms. If there's a cutoff, which is depression, then you can convert them so that all these studies have the same outcome, then that's fine to combine. So that's just an example when you might make it more homogeneous, I guess. Yeah.
Yes, that's agree. And the third question is, if the systematic review available was published 5 years ago and currently there is a growing evidence of clinical trials, can we do an updated systematic review for the similar topic? Well, I can say yes, you can do. If you found that there's more studies coming, especially for the clinical trial, and you would like to do the updating of systematic review, yes, you can do the similar topic, but probably maybe if you don't want to a lot of similarity with the previous authors, you can just edit maybe another measuring outcomes, because the 5 years ago clinical trial compared to current clinical trial, they have a different outcome to measure. And then if we found it in the PubMed or the other database, we may see that there are a similar systematic review, but the recent one, sometimes they say the updating systematic review. I think it's from me. Is that what happened? Do you think so, Ed?
I think it's okay to do. Often what you should do though is you should provide a rationale in your introduction or whatever about why you're doing it. So I think something like saying that there is growing clinical trials is good, but also if you're looking at it, like you said, like a different measure or something different, then that's good to mention as well. So I don't think there's anything wrong with doing it if there's another paper, as long as you cite that other review and you also talk about it in your discussion. So you compare your findings with the previous one and if there's any differences. I think that's okay too.
Yeah, I think that this is also what happened especially in postgraduate student, when we need to do the systematic review to make as a foundation of our research, and then we just found all right, the other authors already published the review. We'll see if there are more studies coming, then we still can do the updating of the systematic review or meta-analysis. Yeah, we will get that. Probably
I think the answer is clear for these 3 questions. I'm gonna show the next question.
Yeah, okay. You would like to read it first? I cannot read it from, okay. Can I do systematic review for effectiveness of intervention and health education, but I include RCT and non-RCT design? What's in it for the explanation about the studies done that can be okay. This is quite a long question. Okay. Of course, again, if you like to do the systematic review regarding the health educations, it depends on in your PICO questions, whether you are aiming to include only RCT studies or you will also including non-RCT design. Because this type of study is going to affect how you answer your clinical questions. For example, if the health education, if there is not many paper that has been designed as RCT to measure the health education intervention, and then you maybe need to consider about to include the non-RCT design. That's for the systematic review. And again, if you found that there's no similarity or it has a different intervention, probably you cannot do putting the whole data as one, but you can just describe of the each study and the reason why you included also the non-RCT design, because you want to answer the effectiveness of the health education and etc. And I think Ed, you can add it from your perspective.
Yeah, I agree.
First question.
Yeah, it's fine to have a mix of study designs, especially for education research. It often is RCTs. It tends to be like, pre-post study or a survey or something. So you're unlikely to get a lot of RCTs. So like you said, it's probably less likely to be combined statistically in a meta-analysis, but definitely as a systematic review, you can talk about it descriptively, and you can kind of talk like in general, like did most studies show a positive effect or an effect? You can talk about that generally, but statistically, I don't think there are probably going to be a whole lot of different interventions, different outcomes. So probably meta-analysis wouldn't be suitable.
Yeah, I think that's what for my paper about systematic review, and I believe this one of your paper for in your PhD is also talking about there's only 2 studies that can be done for the meta-analysis. Is that correct? If I'm not mistaken, that one, like there's like we are including all of the non-RCT design, but then only 2 RCT that can be done meta-analysis. I think that's still possible to do that, right?
So basically, technically, all you need is more than one study to do a meta.
Yeah, technically it's more than one
technically,
study.
Whether it looks good or not, it doesn't matter.
Yeah,
but
okay.
It's,
And then I think that the other question, how statistically analyze the risk of bias for each study used? Well, I'm not sure whether there's a software to statistically analyze the risk of bias in terms of probably like the odds ratio or that's just as mentioned previously. But when you want to do the risk of bias analysis based on the Cochrane review guideline, I think it's just like analyze. There's if I'm not mistaken, there's a score whether there's have a highly in bias or low or middle. If I'm not mistaken, there's a like some. Is it like some dot like in the form? Yeah. And then you just decide. You decided by yourself whether it had. For example, if the one study explained that all of the participants were assigned in without knowing, blinded assigned in whether they are put it in the intervention or the control group, and then you can just put it as the whether it's have a high risk of bias, low risk of bias, and something like that. And but I'm not sure whether it can be analyzed statistically, because as far as I'm not, statistically analysis is just like when you are going to see the heterogeneity of the study or the effect size. Is that correct, Ed?
Yeah, that's correct. So at the stage of assessing risk of bias or quality of the studies, there's no real statistical analysis. It's like it's just 2 people screening the papers and assigning scores of quality, like if it's high, medium, or low quality. Just to mention as well, there's the type of quality assessment tool you use depends on the study design. So there's like the Cochrane risk of bias tool for RCTs, and then there's ones for non-RCT designs and blah, blah, blah. What you could do, I guess, in terms of statistical analysis, if you were doing a meta-analysis, you could, for example, exclude the poor quality studies and just include the higher quality ones or something like that, I guess. But I don't think there's any way to statistically analyze risk of bias. It's really just reporting the proportions of high quality, medium quality, and low quality studies. Yeah.
Yes. Yeah, and this is what I mentioned before. This is really important to collaborate with your supervisor or other colleagues who have an expert in the methodological quality assessment. Because for us, if we don't have any enough methodological quality assessment, it's going to be difficult to assess whether this study have a low quality or high quality or something like that. So that's like type of studies that needs to be understood by the authors before they are doing the systematic review. And then while we are suggesting to register our proposed review before we start conducting systematic review, when again, like register your protocol is sometimes you don't have to, but some journals, from my experience, they are always asking whether the protocol of your systematic review or meta-analysis has been registered or has been published in Prospero. And it's the good thing is, if we publish our protocol before we started the systematic review, sometimes the Prospero teams will give some feedbacks before we are doing. But if you are working with the Cochrane review or Cochrane collaborations, and then they are agreed to publish your registered title of your systematic review or meta-analysis, you definitely need to publish your protocol with them. But if you are not doing the review with the Cochrane, well, some journals are suggested to publish our protocol. And the protocol is a good thing for you and your co-author as a guideline. So all authors will comply to the protocol and they're not going to change their mind in the middle of the searching of the review. And this is very useful, especially for the postgraduate students. That's my opinion. What do you think, Ed?
Yeah, I don't have much to add, really. Like you said, some journals require it. It's always, I guess it's good to do it because setting up a plan for your review. Also, it's done a priori, so before you start or kind of at the early stages. I think now Prospero say it has to be done before the data extraction phase. So I think it just shows that you're not changing things as you're going. You've got a plan. And it adds more credibility, I think, to the review that you're doing. So yeah, I mean, it's good to register if you can. Yep.
Yeah. Okay.
Okay. And then the other question from Shafaisal.
Yeah. Buketa, maybe you can read it, the questions.
Okay.
If you like.
Yes, Shafaisal is a postgrad student in Universitas Airlangga, Faculty of Pharmacy. We are conducting a systematic review, and we find some articles comply with the P code except comparison group, or there is no clear information about the comparator, or they didn't analyze or compare the result with the intervention group. What we should do in that case for article inclusion or exclusion. So it's about a comparison group.
Yeah, okay. So if there are some articles that explain, that comply with your PCAT questions, but they don't give any explanation about the comparison group, and there's no clear information about the comparator, I think you can still include it in your review or as an included study, because these articles already met with the inclusion criteria, except they didn't explain the comparison group. You can mention in the results or of your paper just saying that this is no clear. But again, that's the first step. But the second step, if you know that most of the articles or most of the study that you found, based on your PCOT question, they have the similar condition like this paper. And then if you exclude all of them, you probably end up with just like one or two. But again, if comparison group is very important and they they just need to be assessed to answer your clinical question, you may exclude this article. But if you think the comparison group, it doesn't need, because you don't need the comparison group because you only included the study that been follow up, it doesn't have to be RCT, it doesn't have to be a clinical trial, cohort study design is fine, then you can include it in your review. But if the RCT, I think for the RCT, whether it's randomized or not, comparison group definitely need to be mentioned in paper. Yeah, I think so. That's from my opinion. Do you want to add something, Ed?
No, I think you answered it well. I would do the same thing as well.
Yeah.
So I think it really depends on your own research question and your inclusion exclusion criteria for your review. So yeah, if you're doing it on RCTs, it would make sense to have the comparator group.
Yeah.
So yeah, I think what you said is good. Yeah.
Okay. Yeah. For the next question, we get that.
Yep. Okay. The next question is from Anisha again, from Universitas Brawijaya. Which one is better for publication article at high H index or I factor? I think it's related to the metrics that Dr. Tan mentioned before. Yeah.
All right. I must admit, I'm not the perfect person to ask about metrics. When you say I factor, are you referring to impact factor or?
Yeah, I think that's an impact factor and
yeah. So I think for journals, usually we use impact factor. That's the one which is more easily recognized for journals. For H index, I tend to use that more for people. I know journals can use an H index, but I see it more about when you're assessing a researcher, because the H index is based on the number, I'm going to say it wrong, but the number of publications you have that have that number of citations, I think. So the better you are. So this isn't based on anything, but what I do is I would assess a person by the H index and a journal by the impact factor. Yeah. Whether it's correct or not, I don't know, but that's how I do it. Elida, did you want to?
But I think what you say is correct. So high index refer to the researcher or to the authors. And this is, I think the high index was designed by Scopus. So it's just like to mention like the highest high index of researcher of a person. It means like the highest citation that the person have and or the paper that he published. But for the impact factors is related to journals that you have already mentioned about the metrics. Well, again, which one is better? Well, sometimes I'm not sure about it in Australia, but in Indonesia, like the researcher or lecturer, they are required to publish in the, it's not only high impact, but now it's just like paper that have a related metric in Saimago that you are mentioned, like the key one. Yeah, I know that key one is always better than key two, but again, it's based on the major of the research, right? We cannot compare with other disciplines. So the key one in discipline here could be different with the key one in other disciplines, right?
Yeah, exactly.
Yeah, so again, there's like we can say which one is better, but of course, like you want to publish an article, just like the Ed mentioned before, is like it depends on our research whether we are aiming to the Lancet or New England Medical Journal, while we are only have like 25 or samples. Like there's kind of thing that probably we need to consider. But of course, high impact factor is also good for us if we want to build a portfolio as a researcher or as a lecturer, I think. Yeah.
Okay, thank you. Thank you for the answer. And there is still question here from Arifin from Airlangga University. How to compare this reputable journal and journal Predator? Please share tips how to minimize impact for Predator journal. I think how to recognize which one is reputable journal and predatory journal.
Yeah.
Which one?
Ed, you want to answer the question? Yeah.
Well, I can just base this on personal experience. So I guess sometimes you guys get those spam emails about
Yeah, that's true.
Journal.
Yeah, we have some journals that requires you to publish and something like that.
I would call those predatory, the ones which approach you with a badly written email with your name spelled wrong, and avoid anything like that. There is a list of predatory journals available online. It's called the Bales list. Are you guys familiar?
Yeah, we are using that Bales list as well.
Yeah. So just double check if the journal is on that list, because if they are, then it's a predatory journal. Make sure you speak to your supervisor or other colleagues before. If you're unfamiliar with the journal, speak to them. I've done that before. I've called up the research office and gone, what's this journal? Is it a good journal? Because it has a good impact factor and stuff. And they've come back to me and go, oh no, it's a predatory journal. Don't go for that. So yeah, just ask other people. But generally, I avoid journals which ask me to submit to them. To them. Usually, they just want you to pay a publishing fee. That's why they get you submit to them. And you'll become familiar with what journals are good within your discipline as well. So a lot of it's just about experience, and just keeping your, being aware of the sorts of things predatory journals do. So
that's true, that what just Ed mentioned, like especially for us, when we got an experience like to publish for the first one, and then suddenly we receive a lot of emails to asking about, we read your paper about this, and would you please submit to our, and then that's definitely scams or like predatory journals. But then again, like we are using a Bell list as well in Indonesia. And in Bell list, they are using like the list of the not only the predatory journals, but also now the publisher, the predatory publisher. So you can check whether the journal is listed or the publisher are listed in that list. But again, through experience, sometimes we will also recognize the website that looks like this is definitely a predatory journal. From the website, we can see the difference. Right, Ed? Because I know like the good journals, sometimes they having like at least like using the scholar one, the scholar wants to submit their paper. But if the journal is just like using like, okay, submit your paper through our email, that's definitely scam. That's definitely a predatory journal. And then sometimes we found like those who are indexed in the predatory journal, sometimes the list is already updated. So just be careful to see whether this is the journal that you are targeting are predatory or not. I think that's, talk with your supervisor, talk with your colleague that has an experience. I think that's a good thing to do.
Yep, right. I think I remember the slide that Dr. Tan shared with us. There is a table with the list of the journals in the schema Go. I think we also can use that to choose the reputable journal, and also see the Q1, Q2, and others. Okay, next question. From Zamratul Iza from Universitas Airlangga, would you please share about replication studies? Sometimes we conduct similar studies that published previously, but in a different practical settings. So what about this?
I think that's fine, as long as you can highlight how it differs to the previous study. So you would have heard of the term Me Too studies or salami publishing. Try to cut up your paper, you cover up your research into multiple things. There's nothing wrong with that, but you just need to be able to distinguish this new paper from the previous one. So something like a new practical setting, like a new practice, is fine. So say it was a different, I don't know, like a different country or different city, or it could be a different, say, community pharmacist versus general practice, or whatever it is. I think you just need to emphasize how that is different. And then make sure you cite that previous paper as well in your paper. The likelihood of it getting published in a very good journal is probably lower if it's quite similar, but I would say it's still publishable, but maybe it's not super high. What do you think, Elida?
I think I agree with what you're saying. So it's not impossible to it's not impossible to do the replicating study, but because like probably different country have a different setting. But again, if it's not enough to just saying like in different country, but you have a similar, exactly a similar methods, like even sample size, you just need to make like what's your study that difference, or probably you already found, you can find the gap between your aiming studies and the previous study, and you are able to find the gap. And then that gap, maybe that needs to be written when you write the background. So the journals will see, okay, so this study is a bit similar, but this current study, they can find the gap. That's what I'm saying. That is not, that were not answered by the previous one.
And make sure in your discussion section, you compare your study and findings with the previous ones as well.
Yeah, that's a good thing. Pugeta?
Okay, as I mentioned before, there is questions that's still in the chat that I haven't had a chance to put it on the slides. So I will just read it. Sorry. Okay, from Arifin again. How to join a research project with international lecturers with the aim to of applying for a master study by research. Please give some tips so that we can accept. I think. Please give some tips so they can accept our research project design for proposing a master degree in by research.
I think you are more expert to answer this.
Well, I was going to say you maybe.
No, but probably I will edit something from you. You have like more experience as for applying grant, or I think this is the best.
So I haven't studied overseas, so I'll talk generally about how I got international collaborators and things. And I think Elida can talk more about doing a master's in degree. So for me, I was very fortunate to have supervisors who knew people. So I would say a few things. Ask around. So if you're interested in working with a particular group or whatever, try to see if there's a connection somewhere. So maybe your supervisor knows someone or they've worked on a paper together. It's kind of like who you know in that essence. So it's about expanding your network. I hate it when people email me this generic email, dear Professor X, I'm interested in doing a PhD in your field. Like it's so generic. I'm blah, 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 blah. Here's my CV. I delete those emails because I don't know who that person is. I don't know if they're good. No one's recommended them to me. It's not even personal. It's not even addressed to me properly. Like it's just a generic, delete that. So don't do that. Speak to someone who knows the person you're interested in working with. And if you want to write an email saying, oh, look, I work with Elida and she suggested that you might be a good person to speak to. I'm interested in doing this project, looking at this. Our research areas are very similar. Is it okay if we have a chat over Zoom about potential to do a master's or whatever it is? You gotta don't go cold calling people. Try to know someone who is able to introduce you if possible. Okay. Or if there's literally no one who knows this person, just say something like, oh, look, I'm really interested in your area. I read your paper about this. I'm doing something similar. Don't go into some generic thing which doesn't make sense. Like I've had people talk to me about lab science and toxicology, things I don't know anything about. But if someone approached me about geriatric pharmacy and they go, I read your recent paper published here, I'm doing a similar study, can we have a chat? Then I'll be happy to talk to them. So it needs to be a good initial sort of partnership, like make sure you approach them in a good way. And most people are generally happy. I think a big thing is funding. So if you're able, if Indonesia funds you to do somewhere, then I think anyone is happy to support you. Yeah, that's another thing. Think about exchange programs through your school as well, and try to apply for travel grants, things like that. I think that always helps. Funding always helps. Elida, you want us to add?
Yeah, I agree because I agree. No, I think my question is, are you looking for PhD students at? Because probably some of my students or my colleagues are interested to study in Sydney. Because like the important things I think about finding supervisors, because again, for us, like who wants to go to study abroad, like we never know that person. We just email some, yeah, probably don't, I'm not going to say a random, because random is just going to have a negative impact, but it's just like we're targeting some people, and then we just email them for the first time, and then we want to give a good impression to that person. So it's the best way, just like Edwin said, just don't do the generic email, just mention it properly, give the proper salutations, like started with like reading, I read one of your paper regarding this, and I was looking like interesting to doing some project. And then after that, then if he responded and then he or she responded, and then probably is a good way to continue. Or are you looking for a PhD student? Because I'm planning to apply for funding or scholarship from the government, and we will be able, just need a letter of support from like a supervisor or future supervisor to apply that scholarship. I think the majority or the most of the supervisor or the lecturer are more than happy to support or to give a support letter, right, Ed?
Yeah, I think so.
Yeah.
If they think there's a genuine,
the genuine,
be happy to support. Yeah.
Yeah, or you can also like asking like just Ed said, okay, I know Dr. Edwin Tan, and then I know that you are previously collaborate with him, and I know personally, and then probably it's just a good sign, and that person will ask Ed, do you really know this person? I just want to check. Or this person is just mention your name randomly, or probably like that. Yeah.
Yeah, exactly.
Yeah, I think that's probably hopefully answer the questions we'll get that.
Yes. Okay, ladies and gentlemen, I think all questions have been answered. And also the time is only 5 minutes left. So I think I'm gonna wrap up this webinar. Okay, before I close the webinar, I would like to take the conclusion of what the speakers have presented. So the first, regarding to conducting systematic review and meta-analysis, we need to recognize the research design first, and then we should know the key or tips, such as the topic, whether the topic is needed, whether there is no identical systematic review that have been published. And then also we need skill to formulate good clinical question. I think it needs practice to formulate a good clinical question. Also including recognizing the type of studies. And also the speaker also mentioned about reference management skill. I think it's also important. And be familiar with the standard format of reporting of a systematic review and meta-analysis, such as PRISMA, and make sure that the PRISMA checklist is completed. And also the next is, for the meta-analysis, it is beneficial in increasing power, improving precision, also answering questions that was not posed by the original study, and then to get the overall result from all studies. And also, I would like the participant to remember 2 stages process of meta-analysis. The first is summarize statistic result from each study, and then summarize or combine intervention effect or weighted average. And then we also need to, it is important to recognize the heterogeneity from studies. And then skill to use the meta-analysis software is also useful. And most of all, we need to consider the priority and who will benefit from our work. And then consider various kind of journal level metrics, in deciding right journals to publish your article. And the last one is we need to apply strategy to make our manuscript looks interesting, logic, and important by having strong title, abstract, cover letter, and other strategies. So, ladies and gentlemen, I think that's all for this webinar. I'd like to thank you so much for the speakers, Dr. Elida Zairina and Dr. Edwin Tan, for so informative and interesting presentations, and to all participants for very active participations. For Dr. Edwin Tan, I hope you have chance to visit Indonesia, especially
definitely.
Thank you.
Yep, very soon after we've done with COVID-19 pandemic.
Sounds good.
Yes. For the all participants, hopefully the webinar will be beneficial for everybody. And thank you very much. And I see you at the next webinar. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ed, can I just talk to you a bit about the things that, because we just very rare to see virtually. Kita sebentar ya saya. Yeah. If regarding about the schedule that I would like you to give a lecture that included in the subject, is that okay? I will email you the detail later on, because the lecturer will still probably, I was thinking like in November, like I think the third, yeah, like the third and the fourth weeks of November, like
I should be available.
Yeah.
So the third or fourth week.
Yeah, the third and the fourth weeks, because
so the 16th or 23rd.
Yeah, probably between 23rd, in the week of 23rd and 30th of November, because I just checked the schedule. Probably that's the best way, but I'll let you know if there are something changing. But this is like the subject for the undergraduate students, and this is like the subject. I'll email you the detail and about the topic later.
Yeah, I have a conference during that time, so I'll just need to know when.
Oh, okay.
The dates when you know.
Yeah. Okay, I'll give you the possible dates as soon as possible. But if it's not November, or probably is it September is good for you?
Maybe. Give me the dates for just give me the dates later for November. Or September, and I can work out.
Okay. I'll just gonna make the schedule for this subject, and then I'll let you know.
Because it's all virtual, so even if I'm at the
it's virtual. I know. Like this is because it's virtual, so we not only have 8 hours a day, but we have 24 hours. That's just like ridiculous. I think this is gonna forget rest. Okay. Thank you so much, Ed. Thank you, Ppjpi. Thank you, Mbak Tere. Thanks you, Space Indonesia. And thank you, Bu Gesnita. I'll see you around. Ed will be in touch soon. I will send you a message after this asking about something that. All right.
Sounds good.
Have a great
Thanks,
day.
everyone.
Yeah. Bye. I'll see you, Ed.
Bye.